to all diseases of public health importance, creating opportunities for synergies, efficiencies, and resource maximization. So as to the purpose of this Digital and Data Use Forum, it's aligned with the Federal Ministry of Health and Social Welfare's National Health Sector Renewal and Investment Initiative, the NHSRII. It's aligned with the USAID's Vision for Digital Action in Digital Health 2020-2024 and Africa CDC's Digital Transformation Agenda and other national frameworks and policies. Now, all of these initiatives underscore a pivotal moment wherein concerted efforts are essential to bolster governance, health enterprise architecture, and interoperability standards within Nigeria's digital health landscape. Data is no longer a commodity, but a necessity for survival and growth in the modern era. As regards our expectations for this forum, they would be that it serves as a pivotal platform for fostering both implicit and explicit conversations, sharing ideas, collaborative learning, and establishing a robust network of collaboration to realize the national goal of digital transformation. And as a call to action, we would like to implore all participants to actively engage in the conversations that we'll be having in the course of these 2 days, as together we can realize the collective emerging benefits of digital transformation and maximize digital solutions and digital utilization strategies for informed decision making. As we navigate through the dynamic landscape of Nigeria's digital health transformation, it is our sincere hope that these sessions will facilitate inclusive learning, offer innovative solutions, and deepen discussions on leveraging our collective efforts to drive efficiency within Nigeria's digital health ecosystem. We remain optimistic that the insights gleaned from these discussions will contribute significantly to ongoing efforts aimed at strengthening digital health in Nigeria. I wish everyone a profoundly enriching and productive event filled with engaging discussions, knowledge exchange, and inspiring insights. Before I conclude, I would like to once again, on behalf of my colleagues, express our gratitude to all the esteemed participants for gracing us with your presence, and extend our appreciation to the government of Nigeria at both federal and state levels for their unwavering support and leadership, and offer heartfelt thanks to USAID for their steadfast commitment to advancing digital health in Nigeria. Thank you very much.
Thank you so much, Dr. Dauda, for that welcoming speech. We'll be going into the goodwill messages from some of our partners and esteemed guests. And it's my pleasure to welcome to the stage Engineer Kudumi Hawk, the Director of Special Duties from the National Agency for the Control of AIDS, representing, the Deputy Director, representing the Director of the National Agency for the Control of AIDS. Please, may you join us on the stage?
Good morning, all. Apologies from my Director General, Dr. Temitope Ilori. She's unavoidably absent, so she has asked me to come over and represent her. So I'm just going to read the message she has sent across. Esteemed guests, distinguished colleagues, and partners in public health, on behalf of the National Agency for the Control of AIDS, I'm honored to welcome you all to this important forum on digital data use in public health. The digital revolution has transformed every aspect of our lives, and healthcare is no exception. Today, we stand at crossroads with the potential to leverage the power of data and digital tools to revolutionize public health interventions. While we have made significant strides in the fight against HIV and AIDS, new challenges and opportunities constantly emerge. Data is the fuel that propels us forward. This forum represents a powerful platform for collaboration. We are bringing together a diverse range of stakeholders, government, donors, healthcare professionals, technology experts, and public health champions. Your combined insights, experiences, best practices will be instrumental in leveraging the transformative power of digital data to optimize public health interventions and ultimately save lives. The use of digital data has revolutionized the way we approach HIV and AIDS. Imagine a world where real-time data on treatment adherence can empower healthcare providers to intervene quickly and prevent viral load increases. Imagine a future where targeted interventions reach high-risk populations with pinpoint accuracy, closing the gaps in prevention and care. This is the future that we can build together as we work together. This forum is quite essential. By sharing knowledge, fostering innovation, and forging strong partnerships, we can harness the power of digital data to strengthen health systems, optimize resource allocation, and accelerate progress towards an AIDS-free generation. Thank you for your dedication to this critical cause.
Thank you so much, sir. Thank you so much, sir, for those goodwill messages from NACA. So next person we'll have here on stage will be from NCDC. We'll have Dr. John Oladejo from NCDC. Please, a round of applause for him as he takes the stage.
Good morning, everyone. My name is Dr. John Oladejo. I represent NCDC here. So on behalf of the Director General, Nigeria Center for Disease Control, Dr. Olajide Idris, I bring a warm greetings from NCDC. As a matter of fact, DataFile has been one of our major partners when we are talking about healthcare development, as well as the strengthening of the infrastructure, especially when we are talking about data. So what do we do with data? This is a digital, we're now in digital world, and you know that digital health is a general term to describe the use of internet solutions, big data and communication technology, at least to collect, share, and manage health information to improve health individual as well as public health. DataFile has actually excelled in this area. We started collaborating together since last year, and they have really done a lot of work with us, supporting us in our public health intelligence reports, which we always collect every day by 3 p.m. All the surveillance officers as well as the technical officers, we always come together to really look at what data says and be able to know which of these diseases is actually rising and giving us a very wrong signal and then we always deal with it. Recently, they have actually supported us in, renovating our ICC, that is Incident Coordinating Center. I think they deserve a round of applause for that because they have spent a lot of money, and very soon now it's going to be handed over to us officially. So coming here is a great pleasure for me because they have really made my job easy as the Director of Health Emergency. And when we're talking about EOC, we're talking about how do we manage data, especially when we're talking about digital health. So this forum is very, very important to us because this is where some of the challenges we are facing, most of it will be discussed, and then we'll be able to really get a lasting solution to it. So having said this, I'm very happy to be here, and I wish the forum a very good deliberation. Thank you, and God bless.
So thank you so much, sir, for those welcome remarks. So the next we'll have on the line would be from PEFA, and gracefully we have Dr. Bodunde Onifade to give us some remarks from PEFA. Please, a round of applause. A round of applause, please.
Good morning, everyone. Yeah, the deputy coordinator will still join us to represent the PEFA coordinator, but just to say that this is a good innovation. I remember this is the second I'll be attending, and it is very good since the country also, the Honorable Minister of Health is also doing something on digitalization of health system. And I think for us as a private organization, we need to align our resources to harness every effort by the government to digitalize.
Will that is now on in terms of whatever intervention, whatever innovative idea that we're bringing on. The Honorable Minister of State for Health, His Excellency Dr. Tunji Alausa, is the chairman of the new Nigeria Digital in Health Initiative. So what is it all about? Just all about trying to see how we use digital to improve service delivery in all our service facilities in Nigeria. And in addition to that, to try to see how we can create a platform where all the effort that we are putting into improving the health outcomes of Nigeria is all together and it's available for all the policy decision makers to be able to make an informed decision. So having this gathering today is key, and tomorrow, for us to deliberate on the way forward in trying to see how we use those data to improve decision making as much as possible. So it's my privilege to be here, and I believe that we are going to really have a very exciting and educative time. I will employ every one of us to try to see if it's some people that are supposed to be in this meeting, they are not here. Let's try and call them now to come, because this is very key. Thank you very much, and I wish us a fruitful deliberation.
Thank you so much, Doctor. Next, to give us his goodwill message on behalf of the United States Center for Disease Control and Prevention, I'll be inviting Dr. Dennis Onoto to the stage. A round of applause, please.
Good morning, ladies and gentlemen. Permit me to leverage on already established protocol. As I was rightly introduced, I'm Dr. Dennis Onoto, the branch chief of the Continuum of Care and Treatment with U.S. Centers for Disease Control and Prevention in Nigeria. I bring greetings from the leadership of U.S. Centers for Disease Control and Prevention in Nigeria, led by Susan Terrell, who's currently the acting country director. First, let me congratulate DataFi for organizing this very important event, bringing key stakeholders, technocrats, and experts in the digital field to discuss digital and data use as it relates to health. This forum is timely, and the focus is quite apt, as accurate data, its collection, use is very there are vast area of digital and technological-driven solutions and innovation that have been used to improve the data use and to make the user experience quite friendly, and to ensure that data is analyzed in a way that the information can help in planning and ensuring that working also supporting initiatives in this space to ensure that data is available in a format that is very readily available and accurate to support implementation, especially working with the Federal Ministry of Health. We have supported the country to build a national data repository for HIV AIDS program. Let me also appreciate the great work that DataFi have been doing and leading the implementation of, supporting the implementation of best practices and sharing solution and innovation to support the work that is being done in the public health space. And with this, I know that with this forum, in this forum, we have the opportunity to leverage on all that has been done and to share experiences and further deepen our understanding and to look at area of opportunities that are there that we can leverage on to support the government of the day in broadening that in the health sector. I therefore wish all of us a rich learning and experience sharing experience during these 2 days event. Thank you.
Thank you so much, sir, for the goodwill messages. Please, another round of applause for him. Thank you. So we'll be delving now into the main sessions for the day. And to start off, we'll be having a keynote address from the Federal Ministry of Health, basically highlighting the Federal Ministry of Health's efforts on health system digitalization in Nigeria as enshrined in the National Health Sector Renewal Investment Initiative. And the person to do justice to this would be Dr. Chris Isokmomo, the Director of FMOH DHPRS. Please, a round of applause to usher him onto the stage.
Good morning, ladies and gentlemen. It's really a great pleasure to address this gathering on digital and data use. Today and for the next 2 days, we will explore a transformative journey reshaping the landscape of healthcare in Nigeria. The digitization of health systems, as it is enshrined in the Nigeria Health Sector Renewal Initiative, is what I will be talking about today. What is this Health Sector Renewal Initiative? It is the strategic blueprint of the present administration to reduce pain, reduce financial and physical pain, save lives, and produce health. It is premised on 4 key pillars. The first pillar is around governance, healthcare governance. The second pillar is around improving the quality of healthcare delivery, especially at the primary healthcare level. With the third pillar, looking at unlocking the healthcare value chain. The fourth pillar is the health security. All of these are premised on some enablers. One critical enabler in this is digitization and data use. So you find that this gathering will be looking at deepening government's thought on how digital health can contribute to improving healthcare. The proliferation of numerous parallel, non-integrated data management systems across various specialized programs has created significant obstacles to both the accessibility of data on the DHIS2 and its utilization for evidence-based analysis and decision-making. This fragmentation often leads to duplication, double counting, and data losses, hampering a comprehensive understanding of health outcomes and making it difficult to formulate holistic policies and interventions. Challenges also include suboptimal reporting rates, particularly regarding the coverage of service delivery points, such as tertiary, secondary, private, and community structures. Not all indicators are collected, and issues of incomplete and delayed reporting detrimentally affect quality and utility of health data for planning and decision-making. Data discrepancies and inconsistencies are prevalent in Nigeria health information system due to different data collection methods, inadequate validation processes, and a lack of standardization reporting formats. Misaligned or inconsistent data can result in misinformed decision-making and hinder accurate assessment of health trends. Healthcare facilities often collect and manage data in unstructured methods due to the absence of conventional data collection protocols, leading to data fragmentation. This dispersion of information across multiple databases and systems make it challenging to get a comprehensive picture of the healthcare environment. Additionally, inconsistent data collection practices further complicate data integration and analysis. Accountability is another significant problem. In the absence of a clear structure for ownership, accountability, and monitoring of healthcare data, there is a possibility of data misuse, inaccuracies, or breaches. Inadequate data governance undermines trust in data quality and information produced from it. To address these issues, the Nigerian Health Sector Renewal Investment Initiative is focused on developing a robust framework for data governance and accountability across the health sector. This initiative aims to transform health system from fragmented, incomplete, and poor quality data to a single integrated source of truth data system that supports institutionalized use of data for decision-making, resource allocation, and service delivery. As a first step, we plan to launch the National Electronic Medical Record System, starting with a regionalized pilot. This system will enable tertiary, secondary, and primary healthcare centers to manage clinical and administrative data seamlessly across centers. Our objectives include improving the quality of care, reducing avoidable adverse drug events, decreasing unnecessary testing and imaging costs, and increasing staff capacity and productivity by reducing paper-based administrative tasks. The inauguration of the Nigeria Digital Health Initiative Committee in March 2024 has accelerated these efforts and has sent a clear message as to how government wants to approach this. We aim to strengthen the digital national data governance system, enhancing the capacity of governance organizations responsible for data collection, use, and management. Improving data digitization and data use will entail the following actions. 1, development of National Health Indicators Dictionary. This compendium will track service delivery project and program performance across nearly 40,000 service delivery points, which are actually our primary healthcare facilities, ensuring clear, concise indicator reference list for reporting. This will also ensure that all partners and key players understand the indicators so that they don't mean different things to different persons. Training program. Implementing training programs to equip healthcare personnel with the skills to gather, handle, and use data effectively, adhering to established guidelines and standards. 3, developing and implementing best practices and standardized data collection protocols to provide uniform instructions for data collection in all medical facilities and ensuring high quality and useful data. Number 4 is data security and quality standards. Enforcing standards to data security and quality, establishing precise standards for data reliability, precision, and completeness, alongside strong data security protocols to prevent breaches and unauthorized access. Establishing data quality also ensures and guarantees, serves as the foundation for interoperability. 5, which is often left behind, is the AI-driven data analysis. Collecting data is one thing. Analyzing the data is another thing. Utilizing machine learning and AI to analyze large volumes of healthcare data, revealing hidden patterns, trends, and correlations to inform decision-making. And finally, 6, strategic governance platforms. Improving strategic governance platforms for collaborative meetings. A head data governance committee chaired by the Honorable Minister of Health will coordinate stakeholders at all government tiers, ensuring effective data governance and standardization. Ensuring data quality and reliability is crucial for building trust in the health information system and its outcomes. Through data and digital health initiatives, we aim to establish, within 4 years, an integrated data system that is fully digitized, interoperable, and marked by high data quality and accuracy. This system will be a credible source of evidence for informed decision-making within the health sector. Additionally, we anticipate that within 4 years, 80% of health education to foster acceptance and enthusiasm for digital health solutions. By showcasing successful pilot projects and tangible benefits, we aim to build confidence and drive adoption across all levels of healthcare. Continued investment in digital infrastructure and technologies is crucial. This will involve both public and private sector partnerships to fund and support these initiatives. Establishing robust regulatory framework to ensure data privacy, security, and interoperability of digital systems is essential. We must create a trusted environment, and we are working to creating that environment where patients feel confident that their data is secure. Actively engaging with communities to promote benefits of digital health solutions and addressing any concerns they may have is also key to successful adoption and sustainability for these technologies. I might at this point also add that digitization and health digitization goes beyond data and data collection and data management system. Digitization is about service delivery. So telemedicine and mHealth are other components of digitization that we need to look at in order to expand coverage for universal healthcare for Nigerians. Ladies and gentlemen, this is just a small brief of our vision, the vision of the Nigerian Health Sector Renewal Investment Initiative for digital health and digitization of our health data system for Nigeria. I thank you for your attention.
Right, thank you very much. Once again, please, can we give him a round of applause? It doesn't feel like we're excited. We're not happy about his speech. Please put your hands together for him like you mean it. Thank you very much. Thank you. Once again, would like to very specially take this time again to very specially appreciate Dr. Chris Isokbomo from the Department for Health Planning, Research, and Statistics at the Federal Ministry of Health and Social Welfare. Thank you so much for finding time to come over to deliver this very solid and powerful keynote address this morning. Once again, would like to welcome you very specially again. Thank you for taking time out of your very busy schedules to be in this place this morning to be a part of the Digital and Data Use Forum 2024. And like you've already been listening to our speakers and the people that have been coming up to speak this morning, this is a very important event. This is a very important forum. And we want to believe and trust that at the end of this forum, you'll be leaving here very equipped to understand and to meet the reason why this event has been put together. Now, before we move on very quickly this morning, I'd like to make a very quick announcement. Just in case, if you look at your table, if you can see this. Can you see this on the table where you're seated, please? I just want to be sure. Please, if we're together, please kindly check if you have this on your table very quickly. Thank you. Right, so these barcodes here, you're supposed to scan them. We want to receive your questions. We want to have an interactive session. And for us to be able to do that, we'd like to receive your questions. So please, for the different presentations that we'll be giving in this place, we'd like to take your questions from all of this. So kindly scan the barcodes here for any of this, and please send us your questions as we get to receive them to let our presenters provide answers to all of your questions this morning. Please, we'd like to take them as much as possible. Thank you very much. And now in the next few minutes, I will be inviting our next speaker to come forward and speak to us. But before we get to have the next speaker, it just feels like the room is a bit dry this morning before we get to bring the next speaker up. I want you to turn to the neighbor who's seated by your left and by your right and welcome somebody very warmly into the hall very quickly. I can't hear you. I want you to make sure you do it like you mean. Please welcome somebody. This is also an opportunity to network, to meet somebody who's seated right next to you. So don't come to an event like this and just step out without meeting somebody. Introduce yourself to the person. My name is Naomi. This is a good time to introduce yourself to the person. Let the person know you, let the person meet you. Thank you very much. That's a very good way. I see some people who are not doing that. It doesn't feel like you're excited about being in this space this morning. Have you finished introducing yourself? Right, we've done that very specially. And before we get to still introduce the next speaker, there's something I like to do very important. For me, it is a very important part of hosting any event for me, and it's very important. I want you to show the person who's seated right next to you. The person who's seated right next to you needs to know how important and how special you are. So before we do that, I'd like to prepare your mind. It's just a very quick game. It's a very quick game in the next few seconds. And I want you to celebrate yourself like a very special person. If you had an opportunity to celebrate yourself, to the point that you will clap for yourself and the person who's seated right next to you would be jealous, how would you do that? So let's do that very quickly in the next few seconds. I want you to celebrate yourself. We are going to welcome you. You are going to welcome yourself and recognize yourself like a very special individual, just like the person that you are. So let's picture this very quickly. Can I have your attention in the next few seconds, and then we'll introduce our next speaker. If God gives you an opportunity and says, I give you a chance to determine how long you will be living, you get a chance to clap for yourself, you celebrate yourself enough, and by doing that, you get to determine the number of years that you'll be living. So for instance, you clap small, you get 10 free extra years. You clap again, you get 20 free more years. You clap again, you get 50, you get 100. So this is an official recognition and welcome for you. Distinguished ladies and gentlemen, I want you to recognize yourself by yourself. You are the honorable chairman and the chairlady of the table and the chair that you're occupying this morning. Please put your hands together for yourself and recognize yourselves. You are not clapping like you mean it. Can I hear you? I can't hear you. I want the people in the other hall to know that you're celebrating yourself. So now you're clapping now for 10 years. Can I hear you? For 20. We're stepping it up to 50. We're stepping it up to 70. Keep clapping, keep clapping. To 100, can I hear you? To 203 years. It's okay, we'll pause for a second. When I walked into this place, they were asking us to clap, and it just felt like we borrowed our hands to come into this place. It feels good to know that we can still make use of our hands. Thank you very much, distinguished ladies and gentlemen. We'd like to thank you. And now, very quickly, without further ado, we're going to get into the next presentation that's lined up this morning. And the next presenter will be representing... We'll be having, he'll be joining us virtually, actually, and we'll be having Patrick Mbom Kasiana, Advisor Digital Health, AI and IT at the Africa CDC. And this morning, he'll be speaking on main stage, from blueprints to practice, perspectives on health system digitalization in Africa, lessons from Nigeria. Distinguished ladies and gentlemen, we'll be looking to our screen right now as we receive the next presenter. Thank you very much. Thank you. Thank you. Please, he's ready. Can we give him a round of applause and look to the screen, please? Thank you.
will allow me to present and share. The technical team supporting me remotely, you can give me a okay if I may go ahead and present, if the presentation is visible.
See your screen, can go ahead.
Thank you very much. I'm going ahead. So as I've said, I'm very glad to actually share our perspective as Africa CDC at the continental level to this big initiative that we have at this moment in Nigeria. And I'm very happy to tell you that it's really tallying with the digital transformation strategy that Africa CDC has taken for the whole Africa. And I'm going to go through our digital transformation strategy that has been shared already. This is in public disposition. Anyone can download it. I'm going to share the link for the documentation so that everyone at country level and at people at lower level can actually go down and then collect information from. In fact, the digital transformation strategy itself emanates from the big digital strategic plan of the institution, which is actually to help us be a safer, healthier, and integrated and prosperous Africa, which member states can efficiently prevent disease transmission, implement surveillance and detection, and always be prepared to respond effectively. And then the mission of Africa CDC in its strategic plan is actually to strengthen the capacity, the capability, and partnership of Africa's public health institution to detect, respond quickly, and effectively prevent the diseases, threats, outbreaks that you have out there. So Africa CDC is mostly the institution that is looking after the health security of Africa. But how are we going now as strategically in our ICT support the strategic vision of the whole Africa CDC, which tallies with the whole vision of the African Union? You will see that, as I've repeated in the top here, our vision and our mission, I have put some enablers that is actually looking into the role of digital. We support member states to define and implement to support member states for the adoption into these strategies. And then we support the development of health informatics leadership throughout the continent to foster digital health innovation that meets Africa-specific challenges. And to do that, we do have some guiding principle that has actually pushed us to move into that. Our main guiding principle, we are looking into the population. If I do not want to say patient, but our whole integration, our whole system that we have put in this strategy look and turns around the patients. You will see that we go into looking into patient-centric approaches. We look into open standards for government. We go into regional integration and capability, reuse of what is already there and improve, design from scale for scales and not design for local place without it being scalable. So we design for scales and then we build so that each state is actually sustainable on its own. And then we do some digital leapfrog for innovation solutions, empower healthcare workforce. So anything that we do turns around patients and turn around member states empowerment as well. If we look into our main objectives that we have 7 objectives that we have put in place in the strategic overview, in the strategic transformation for digital. The main one was actually the governance and strategy. Each country needs to have its own governance. So we have to look into what is the maturity of the country and support it so that it's actually having a specific governance strategy for digital health. Interoperability on platform and solutions. Nowadays, we don't need to build anything that is actually in silo. In our strategy, we are pushing member states and we are pushing innovators to build for interoperability at the end of the story, because at the end of the implementation or at the end of the lane, would like to have systems that are talking to each other instead of systems sitting on silos. Digital workforce capability is also one of our main objectives. We would like to have people that are equipped to deal with digital tools. Same as digital public infrastructure and goods, infrastructure and connectivity. And what I'm actually seeing also that is more appealing at the moment is the homegrown digitization in the terms of entrepreneurship and innovations. So from the 7 objectives that we have had to design our digital transformation strategy, we came up with projects that we call flagship. 12 of them are already identified and being put in place. 6 of them are in route to be implemented, and we do have 3 of them that are still on standby but have been identified. So among them, you will see that we have priority, even for the 12 ones that have been put in place. Our priority goes mostly on connectivity, on primary care digitization, on health tech innovation, workforce capacity, and internal digitizations. So these 5 ones, mostly I'll speak about the 4 main ones, the 4 top ones. We have grouped these 12 or 15 projects currently. We have grouped them into the 4 main priorities that I've stated. The first priority, which looks at digital workforce, I have named. This presentation is also going to be to public. I'm going to share it with the presenters so that it's actually shared with the public also there in Nigeria. You'll see that the 4 projects that are here represent actually all of them a synergy and a priority that we look into digital workforce. The Public Health Informatics Fellowship, which is an initiative that has been put in place to groom a growing network of Africa CDC health informatics leaders throughout the continent. We have the Digital Health Workforce Development, which is a initiative that is there to make sure that at the end of 2030, we do have 100,000 clinical and non-clinical staff that are equipped. We do have the Africa Digital Health Network, the Africa Health Tech Summit, which is a hub that actually brings together innovators and investors and everybody together so that we make sure that at a homegrown level, we have innovations that is actually accelerated. So people exchange during those summits. I will show you also at the last slide, the next one, for your own agenda to save the dates. We have also the empowering of women that is also still in the digital workforce. And we are adding one more flagship in here, which is the youth as well. We have seen that the youth has been left behind. So the youth is going to be one of the digital workforce priority as well, and flagship that we are going to add. Same as the health tech innovations, we are going to follow what Nigeria has been putting in place right now. And the main idea with health tech innovation is not to comment to member states what to do, but it's mostly to use what is down there at the member states level, see how we can mobilize extra funds to scale it up, and then it goes to other countries. We would like to see a project that is now developed today in Nigeria be of high and good level, and that can be actually scaled and be used in other countries, even in a French-speaking country, Portuguese-speaking country, or even being put in the eastern side where people do not even speak English, they speak Swahili. So what do we do to do that? We do have this priority for health tech innovations, where we list most of the pillars and most of the project that has been put in place already as flagship for that. Primary care digitization as well is one of them, and then we do have few of our flagship that has been put together in there. And then we have the digital health infrastructure that looks into several other components of our digital health strategic projects that have been identified. So I'm going to go through 4 of them that we have already identified. We have, for instance, in the connectivity one, what we call the Health Connect Africa. This is a project that is actually supported by UNICEF, USAID, Smart Africa, and other leaders, which is actually aiming by 2030 that we do have 100,000 health facilities being connected, 2 million community health workers being equipped as well. So by equipped, what do? We have an acronym that we call ECD. You cannot have a health facility being computerized if you don't have electricity, connectivity, and digitization. So this project looks into mostly bringing power to the health facilities, as long as bringing internet connectivity and bringing smart devices to health workers, community health workers. And at a certain time, it's also bringing infrastructure, because whatever people connect at the last mile, we would like them to serve the community, would like them also to serve the national level for intervention and for decision making. And at the end of the story, we want it also to come and serve the continent, as to know what is happening at the last mile of each country. On the primary healthcare digitization, we are actually pushing ourselves into the Universal Health Coverage Challenge of 2030. We'll see that the first point of contact of every patient is actually into the primary healthcare. So to digitize it, there are few projects that needs to be put in place, as well as to enabling policies, open standards that are actually used to everyone, edited and modified and used by every nations, as well as digitally enable the health providers, education and training, which tallies as well with other flagship that we do have, like the digital health workforce that I've spoken about, and then create a robust entrepreneurial ecosystem, because at the last mile, it's not actually Africa CDC that will go and implement, it's the member state with its group of innovators and entrepreneurs that are there, that will actually be the one that will be used and that will work. So primary healthcare digitization is one of our priority as well. And we have spoken also of digital health workforce. So still by the end of 2030, we are trying to look into enabling 5,000 health systems leaders and 100,000 health professionals that are actually pre-prepared as digital health workforce. So in here, we do have few projects that are being put in place. There's a fellowship, as I've stated it, the fellowship of primary healthcare institutes that is actually being put in place, where we go into universities and equip people, give a new curriculum, and help people at the exit of a university to be ready to go and serve the country as a digital health workforce person. Also for innovation, we do have for innovation what we call the sandbox. The sandbox is actually another project that is going to be put in place. It's still being prioritized, so that at least in this health workforce, we do have in different countries people bringing together the innovations. But in a sandbox, it's like a platform that is open, where we bring regulatory officers, we bring health sectors, stakeholders, we bring entrepreneurs and innovators, and they start deploying the systems. And from the deployment of those systems, we make sure that those systems are respecting governance, are respecting all the regulatory level of standardizations, and on top of it, it's actually ready to be scaled up. So it's more like a place where it will be open to the whole Africa, to the whole continent at a later stage, to adopt whatever has been put in technology outside the continent, and then make sure that whatever we design at entry level, at innovations level, map whatever is set as a continental priority and regulatory respected policies. And then, as I've stated as well, at the end of the year, in October 29 to October 21st, we are going to host in Kigali, together with few of our partners as well, what we call the Africa Health Tech Summit, which is a good place as well, whereby entrepreneurs, innovators, member states come and meet partners, come and meet investors into the digital health industry. And then from there, people talk and communicate and integrate to see how we can do and scale up projects that have been put in place in one country to another, or learn from some other people, or even see where we can make some synergies and any other cooperation and collaboration that can happen. In a nutshell, that was actually what I wanted to present. I apologize for not being in the country at the moment. We are mostly all traveling and preparing our movement to the World Health Assembly. So most of our presence is actually based in the other events. It's my pleasure actually to make sure that I've been contributing for these few minutes in the blueprint practice that we are blueprint to practice that we are doing at in Nigeria. And I believe that whatever documents I'm going to share, or whatever information that we may need at a later stage, may be of interest and may actually accelerate whatever we are doing at the level of the member states. I thank you very much, and I'm open for any questions. Thank you very much.
Thank you very much, Mr. Patrick Mbom-Kasiama. We would have loved to have you here with us. However, we are grateful for your time to join us virtually and for the valuable contributions that you have made today. A round of applause for him, please. So I'm sure we have questions coming up. Please feel free to use the QR codes on the table, scan the code and drop your questions. And when it's time for the question and answer session, we will take all the questions that we have. So just to also reiterate, like Mr. Patrick had said, the presentation that he just presented will be added to the shared events folder. So if you have the QR code on your tag, that's the access to the folder. Please have it scanned. If you've registered, scan it, and you would have access to all the materials that have been used and will be used for this two-day activity. While Mr. Patrick was speaking, we had a very important and special dignitary join us, and it's my pleasure to welcome him to give us a goodwill message. He is the Deputy Coordinator from the United States President's Emergency Plan for AIDS Relief in the person of Emerson Evans. Please, a round of applause as we welcome him to the stage.
Good morning, everyone. Dear ladies and gentlemen, allow me to stand on existing protocol. I apologize for my tardiness this morning. It is an honor to be a part of the 2024 Digital and Data Use Forum on behalf of the U.S. President's Emergency Plan for AIDS Relief and its implementing agencies, the United States Agency for International Development, the U.S. Centers for Disease Control and Prevention, and the Department of Defense. I welcome you to this timely and important forum. The PEPFAR program is excited and committed to supporting President Tinubu's Renewed Hope agenda and supporting the Health Sector Renewal and Investment Initiative. We stand behind the initiative and we are committed to data digitization, quality, and use to inform health service delivery efforts in Nigeria. Thank you for your time, and we look forward to the engagement over the next couple of days. Thank you.
Thank you very much. Thank you. Please, can we give him another round of applause? Thank you so much. And that was the voice of the Deputy Coordinator of the United States President's Emergency Plan for AIDS Relief, PEPFAR. Would like to thank you very much, Emerson Evans. Thank you for finding time to be here this morning. And just like it has been said before now, we will be having questions and answers. That will happen immediately after the next presentation. So please, if you have the questions, kindly take time to scan the barcodes before we get into that segment of this event this morning. Thank you. And now moving on very quickly this morning, very distinguished guests, ladies and gentlemen. I have the very huge honor and the privilege to welcome and recognize and, of course, bring on stage our next presenter who will be speaking, representing the USAID this morning. She will be speaking on digital transformation in motion, reflections from USAID. Distinguished ladies and gentlemen, if your hands are not busy, please put them together as I welcome the USAID Director for HIV and AIDS team. Dr. Rachel Goldstein, please keep clapping, keep clapping, keep clapping. Thank you so much. Thank you.
Good morning. You'll notice I haven't completely made the digital transformation. I've got paper and a device. Director of DHPRS, our colleagues from NCDC, NACA, our colleagues at PEPFAR, CDC. It's really wonderful to see everyone here today to talk and engage about a topic that we all care deeply about, and that is digital transformation. I really appreciate Dr. Chris's remarks and framing where we are now. And I know you have been an incredible advocate of digital integration for a very long time, even before we were all kind of coming together around the coordinating minister's incredible vision that does have that digital transformation piece as one of its pillars. So we're really happy and pleased to have you here, along with a number of our other health MDAs, because I'm hoping that what today and tomorrow really are about are taking us beyond sharing best practices toward really thinking about how we take the next steps toward integration, toward improved governance, and toward simplification with the users, being the health workers and the end beneficiaries, really at the center of what we're thinking about. USAID has long been a committed donor and partner to the field of digital health. both globally and in Nigeria. And what I hope that we can do with the forum over the next 2 days is not only continue to reiterate that commitment, but also demonstrate an openness change. We have heard the coordinating minister speak very eloquently about the critical need to defragment our health system. And our digital innovations are no different. We have applications for immunization, we have applications for tuberculosis, we have applications for HIV. And that's not to say that there's no place for a variety of systems. We have tools such as interoperability that can help them all come together in a way that makes sense. But it's also important for us to rationalize and to recognize that we have limited resources and we have to be constantly and continually thinking about what do we prioritize and how do we move forward in a way that not only doesn't disrupt health services, but really puts that delivery of quality health services at the front of everything that we're doing. The COVID-19 epidemic was an opportunity for us to think more critically about not just what we need in routine health systems, but also emergency responses and the importance that digitalization can play in that. So I really want to appreciate Datify today. They have implementing HIV innovations of USAID, but they've also played a role in supporting NPHCDA and NCDC in thinking about the COVID response. So it is great to see everybody in the same room, and I'm just hoping we can help everyone get out of their disease-specific lens to really think about how do we balance innovation with standardization, because they're both important and they're both necessary. And I think Nigeria, we all know, is at the cutting edge of innovation. But when you have limited resources, we have to also prioritize and ensure a certain aspect of standardization so that we can ensure that everybody is getting that same quality package of services. I really appreciated hearing about the committee around digitalization that Minister Alosa is leading. I think this is going to play a critical role in, let me say, strengthening governance and also providing all the partners that are keen to support the government of Nigeria in this area come together in a very transparent way that both can assess the landscape and provide strategic direction for efforts in digital health. Because we do have to make choices, right? We always have to make choices when we're thinking about what to invest in. We know that health enterprise architecture and developers, these things take time. Anytime you're building something new or making changes to something that's already existing, it takes time to work out some of the areas of challenge. And I think the piece that I want to make sure that we don't forget is that we're not just engaging technical experts, those that are experts in digital innovation and digital health, but that we're also engaging the community and the users that are expected to utilize these tools, because part of our goal, it's not just improved health outcomes, but it's also reducing the burden on our healthcare workforce so that they can spend more time with patients, that they can be relieved of some of the burden that reporting can take from people. I want to highlight a couple of areas where I know Datify has been working. Not to say that this is the way forward for the country, but taking it as an example that we're ready to talk about some of these innovations and also be open to constructive feedback in this forum. So I think the LAMIS Plus electronic medical record has shown how we can take an electronic patient-level system of record that was designed for one disease area and work to expand it. So we've been able to in COVID-19 and immunization module. And so I raise this not to say that this is the system we should be building on, but that when we're tempted to bring something new in, that we should first look at what we have and understand its limitations as we design the next phase. I really appreciated some of the earlier comments around data use. So once we have systems, if the data that they're collecting is not being used, we haven't met our purpose. And some of the analytic portals that make that data accessible and usable for decision makers cannot also be left off the table. So I think we have been able to work with some state-level emergency operations centers to see how they can bring together different sources of data to visualize that data, to make that data more accessible for people, maybe not even just health experts, but your governor comes in and wants to understand what's happening with the diphtheria response in my state, and that you're able to pull data together from different sources and make it presentable and understandable for a variety of audiences. Another area that I think we can learn from is the concept of the community of practice. And the model of community practice that has been used in particular to help shape the LAMIS Plus is something I think that we can draw on to consider how we bring together different users, different needs, different opinions to work toward solving problems collectively and bringing to bear the best expertise that we have available. I wanted also to reference here back to the community and needing to engage with the end users. I think we heard a little bit today discussion of how sometimes innovation can create conception, and I'm thinking specifically about biometrics. And the PFAR team has committed to, while continuing to sort of accelerate our use of biometrics to improve data quality and reporting and even monitoring for the benefit of our patients, that we cannot forget that people need to understand the implications and be assured that their data is being kept and stored securely. So we look forward to the Ministers' Committee taking on board some of these aspects of really defining for donors, defining for technical partners, some of the basic and core requirements and expectations around data systems. And I think just seeing all the faces here, see that we have a lot of expertise and that there is excitement around moving digital health forward in Nigeria. So I think I'm going to stop there and really, once again, appreciate Datify for supporting this forum, but more importantly, supporting everyone is here today because it's your contributions and your openness to frank dialogue that will help us pave a way forward that's well aligned with the coordinating minister's vision and a future with improved health outcomes for Nigeria and a digitally competent health workforce that feels digitization is helping them to also be better providers. So thank you all for coming today. Thank you for the organizers who've put this event on, and we're looking forward to some really exciting and hopefully a little bit of heated dialogue over the next 2 days. Thank you very much.
Thank you. Please, can we give her another round of applause? And this time around, you should clap for her like you mean it. You know why this clap is very important? She can decide to leave this place today and say, oh, these people didn't celebrate me well enough, so maybe DataFi is not going to continue. I don't know how serious that is. So please, this is USAID, of course. They are the people through PEPFAR, of course, that we get the funding to do the work that we do. Please, distinguished ladies and gentlemen, put your hands together for her once again. Thank you so much. Thank you. Thank you. Thank you. Would like to appreciate you once again from the USAID, Dr. Rachel Goldstein, Director from the Office HIV, AIDS, and TB. Thank you so much for being in this place this morning and speaking on digital transformation in motion, reflections from USAID. And now we're going to get into the questions and the answers that we will be having. That section will be happening right now. We had a presentation earlier from someone from the Africa CDC who will not be on the panel for this, so we'll have a representative from Africa CDC join us very quickly. I'd like to, at this point, welcome Olayinka Olayemi. Please, if you're here, kindly join us on stage. Olayinka Olayemi from the Africa CDC. All right, she's coming on stage right now. Thank you. So we have the respondents on stage already. Some questions have already been sent in. So please, if you have more questions to send, kindly use the barcode and then scan it. We're talking, of course, we are going digital, so we would want to start practicing it from this place. Kindly scan the barcode to send in your questions as well. Thank you. Samuel Ferring, if you're there. It's like putting you on the spot. Don't worry. Just be like a soldier who's always ready for war, always ready for battle. Distinguished ladies and gentlemen, we'll have Samuel represent Olayinka on stage, also from the Africa CDC. Can we give him a round of applause as he comes on stage, please? Thank you.
Okay, thank you so much. So before we go into the questions, I'd just like to reiterate two things that Dr. Rachel said while she was presenting. So the first one is, in a world of many digital tools, how do we prioritize the best to have the best outcomes for patient care? And the second one is, how do we balance innovation with standardization? I think those two things are food for thought for us that we'll think through in these 2 days of discussion, and hopefully at the end of the day we'll have concrete answers to them. So thank you so much, Rachel, again for your remarks. So we have some questions that have been submitted. We'll just read them out first and allow the speakers here respond to them. Then if you have any questions on the audience, you have a few minutes to also share your questions. Okay, so another person we would also invite to the stage, because we would have some questions for him, is Dr. Chris Isoponwo to be on the stage. Please, a round of applause. Okay, so welcome to the stage, Dr. Chris. So I'll read the questions we have here first, then we go ahead to entertain questions from the crowd. So the first one here is, how do we ensure accountability and privacy in digital health? Does Blueprint cover these areas? I think this was directed to the first person from the US CDC. So we'll have someone from CDC respond to this. I'll read the question again. How do we ensure accountability and privacy in digital health? Does Blueprint cover this area?
Thank you so much for that question. When we talk about, we're looking at security, right? Of course, Blueprint covers the aspect of security, especially when it has to do with digital health, because security is a fundamental, it's a fundamental aspect or component of digital health. Of course, if people are not sure that their data, their personal information will be secured in the first place, bringing it forth to be a challenge. So like in Africa CDC, part of the things we have done in the last few years is to ensure that we have a robust system that ensures that every health-related data is well secured. Yeah.
Okay, thank you for that response. We have another question. You seem to have a lot of questions here, so I'll just read them out. The next question is, kindly clarify the implementation of the digital sandbox.
So that question should have been directed to Dr. Patrick if he's still online, because he's one of the core team members in the development of that system.
Okay, so that's fine. The next question is, so this would be open to any of the three speakers here. For primary health care, how can we manage and sustain the energy needs here in Nigeria? What are your thoughts?
Can you repeat the
question? Okay, so I'll repeat it again. For primary health care, how can we manage and sustain the energy needs here in Nigeria?
That is actually one of the areas that we're looking at, renewable energy, primary healthcare. A new model for primary healthcare that we have designed and that we are pushing forward in optimizing our PACs is that every primary healthcare facility has a solar power system to ensure and guarantee energy. Because if you do not have power, digital health will be very difficult to achieve. Achieving digital health implementation will be a difficult one. So moving forward, all our primary healthcare facilities.
Many technical partners that are introducing solar power infrastructure to facilities. I think one of the challenges that we identify with that is solar power too requires maintenance. And oftentimes when that infrastructure is made, we haven't necessarily built in the infrastructure to maintain it, to ensure that over time it is well cared for. So something that USAID is trying to bring online, it's called the health electrification and telecommunications approach, something like that. And we're looking at, are there unique and different models where we could introduce solar power at health facilities, but helping everybody to understand that energy is a service. And so it's not a one-off. It's something that if everybody cares about and deems as necessary, that we have to help health facilities and states to understand that it is something that has to be budgeted for, it is something that has to be maintained. But by doing that through solar power, we can make it much more approachable and affordable to health facilities. So we're trying to look at interesting models that we've seen work in other countries where perhaps you have a private sector health distributor or solar power provider who, rather than just buying equipment from him or her, instead you pay a monthly fee. While that monthly fee, which is reasonable, is paid, that provider now lends the equipment, but is due to also maintain that equipment for the duration of time that it's at the facility. Other models that we're exploring are, for example, where perhaps you have a larger health facility, then you could install a larger solar inverter system. Is there a way that that health facility could offer power to the community, thereby creating revenue to sustain the maintenance of that facility to serve the hospital? So I think we want to go even beyond just looking at that initial investment to how can we make solar power more sustainable to meet the needs of health facilities. And I'm really happy also to hear that the coordinating minister has that area as a top priority for reforming the health system. The only thing I really wanted to add to what Dr. Chris said about some of the challenges, I think sometimes we don't think through systems that are needed over time to provide consistent and ongoing technical support to users of data systems. So help desks and ways in which we can create and make it easily accessible for users who encounter challenges to be able to access quick and efficient technical support.
Thank you so much, Rachel. And I think this comments more or less ushers us into the next question. And the next question speaks about the human resource aspect, because as much as we're planning, there also has to be a human resource ready to adapt to the changes that digital technology brings. So the person says, how do we manage change and ensure that employees are equipped to work in a digitally transformed environment? I'll take the question again. How do we manage change and ensure that employees are equipped to work in a digitally transformed environment?
Okay, let me quickly say that innovation is one thing, but ability to use the innovation is another thing. So there is a place of, as been said earlier, training of the staff to do this. I'll give a practical instance. There are a couple of projects we've done for some member states. Part of the contract we signed is that beyond developing these systems, there will be capacity building also. And part of what we do is to ensure that the developers of these tools stay within the member states to ensure that the end users of the system are not just trained, but that support is given to them in case of emergencies. So I think while these systems are being built, it's ideal that the end users, which are those in the primary health care centers or wherever the system might be deployed to, are well trained. If not, you have a very good and robust system, but are not usable. And also, in terms of that too, we should also put into consideration
in ensuring digital transformation is upskilled in Nigeria. No particular order.
It's natural that the Federal Ministry of Health provides leadership, and we are doing that. Government has shown that leadership by at the highest level, with the Minister of State for Health being the chairman of the Nigerian Digital Health Implementation Committee. And again, you have a strategy in place, you have a digital health policy in place, and there is inclusivity, and we'll continue to engage stakeholders. In this committee, we have a subcommittee that is management. Again, still part of that leadership that government has taken.
This LAMIS Plus. So the audience is curious to understand what the LAMIS Plus Committee of Practice is about.
I think there will be other speakers later today that will be some of the challenges that across all of the 600 facilities that are using the system. So people are continuing to face a challenge, not recognizing that they haven't updated their system with, the newest version of the module. Certainly, another challenge that I think we have broadly in the health sector is around, health workers leave. So you've trained someone, they're competently using the system, and they leave. And so really having a user-friendly interface that can make, learning how to use and benefit from a system as user-friendly as possible is very, very critical.
Okay, thank you. So I would just implore us to be a little patient because we have a panel session dedicated to discuss about the LAMIS Plus. So in that session, lessons learned, how that committee of practice is functioning will be clearly stated, and we'll have multiple and diverse perspectives as regards that. So let's kindly be patient for that session. So we are out of time. Would just like thank the persons on the panel and the persons on stage with a round of applause, please, as we guide them back to their seats. Thank you so much for all the comments and responses to the questions so far. Are we tired? Please, let's give them a round of applause. So much has left from them. Thank you.
Thank you very much. Thank you. Would once again like to thank our presenters and the panelists for providing such quality answers to all the questions that have been raised. And remember, we have more sessions coming up, and you can always send in your questions. So if there are some questions you had that you've not been able to send in, we hope that as we move forward, you're able to still feed them into the next sessions that will be taking place. But thank you very much. So we had a little mix-up at first when we invited someone from the Africa CDC to come join the panelists for this session. So I'm just going to come back and state very clearly that she didn't quite run away from answering your questions. She was originally in the house to give a goodwill message on behalf of the Africa CDC. So at this point, before we step out for our tea break, I'd like to take this time to still welcome her on stage, but this time around not to respond to questions, but to speak to us on behalf of Africa CDC. Distinguished ladies and gentlemen, can we welcome Olayinka Olayemi? Give her a round of applause. She looks very good. It's a very good place to clap. Thank you. My sincere apologies. Thank you.
Now I'm in my element. Good morning, everyone. Allow me to stand on existing protocol, and I bring greetings from the leadership of the West Africa Regional Coordination Center for Africa CDC, led by Dr. Herlinda Temba, and thank you for inviting Africa CDC. I'm Oluyinka Olayemi, the National Coordinator at the RCC West Office. So this goodwill message should have come earlier. You've already seen our presentation on the transformational work we're doing in the area of digital health. Africa CDC is committed to strengthening Africa's public health institutions and systems, capacities, capabilities, and partnerships to timely prevent, detect, and respond effectively to public health threats and outbreaks based on evidence-based policies, programs, and interventions. Digital health, as we have seen in the presentations made this morning, is a critical aspect of public health infrastructure. And by strengthening it, we can better detect, monitor, and respond to emerging threats, ultimately safeguarding the health of communities across Nigeria and beyond. Africa CDC recognizes the revolutionary power of technology in improving health outcomes, especially in low and middle income countries. Launched on March 6, 2023 in Kigali, Rwanda, the Africa CDC Digital Transformation Strategy has two main strategic objectives: making Africa CDC an informatics-savvy institution and positioning Africa CDC to support Africa Union member states in strengthening their public health systems. As we deliberate further and dialogue during this forum, let us reiterate our commitment to collective action, collaboration in the pursuit of a healthier, more resilient Africa and Nigeria, of course. Together, we can harness the power of technology to confront the challenges of today and build a brighter, healthier future for generations to come. Thank you.
Thank you very much. Thank you. Ladies and gentlemen, please can we give her another round of applause? All right, so just like you probably know already, we have more sessions that will be coming up, but we do not intend to keep you here just to sit down we're nice people, we're very good hosts. So we're just going to go for the tea break very quickly, and after that we'll come back for the next sessions. But please, we want you to do us a favor. We're trying to also grow our digital platforms, so please bring out your mobile phones. We want you to follow us very quickly on social media. If you have Twitter, or the social media platforms, please kindly bring out your phones. We want you to follow us. Follow us. Probably share the page and let someone also see the great work. On Twitter, it's at DataFi_project. So you can see it. It's on the screen. You can see the platforms. It's on Twitter, and it's also on LinkedIn. You can see it, it's just on the screen. So please follow us on these platforms and make sure that you interact with us as well. It's very important to have you follow these platforms. Thank you very much. Thank you. Thank you. All right, thank you very much for following us on the platforms. If you haven't done so, please remember to do that. So we're going to go for our tea break very quickly, and after that we'll come back, and then we'll get into the other sessions. How many minutes do we have? 30 minutes, right. So we'll be taking the break just for 30 minutes. It's a good time to meet somebody, introduce yourself to someone, network as much as possible, and get yourself something to drink while we get ready to come back for the next sessions. Thank you very much, distinguished ladies and gentlemen. Thank you for finding time to be here. Level 1, 2.
All right, welcome back from the tea break. I hope we enjoyed the meal, and I hope it was light enough to keep us going so that we don't doze in the next session. Please, if you're outside, kindly join us inside because we're about to start or resume with the first session for the day. If you're outside, please join us inside so we can resume with our event for the day. For those outside, please join us inside so we can continue with our program of events. Thank you. Once more, welcome back from that short tea break. We will be resuming with the very first panel discussion we have scheduled for today. We are excited to have on stage very soon very knowledgeable experts that will be speaking on the topic harnessing the power of LAMIS Plus suite of applications and its integrated features to improve health outcomes, a developer and user's perspective. To coordinate that process, my honorable co-host will be joining me shortly. I hope we enjoyed our tea break. Did we enjoy our tea break? I hope it wasn't too heavy. Okay, so I'm expectant. I'm very hopeful that we won't have any executive meditations. We are going to be very alert. So calling on my co-host, Dr. Abba.
Okay, so just like Abigail has said, we have some heavyweights in the house who will be taking us through the next panel session. And the topic of the panel session would be harnessing the power of LAMIS Plus suite of applications and its integrated features to improve health outcomes. So we'll have both the developer's perspective and we'll also have the user perspective. So we'll have the honors of having some great persons in the house join this panel session. The first person Okay, so we'll have a moderator for this session. I'll just introduce the moderator and allow her to introduce other persons on the panel. So the person who will be moderating and also be presenting is Noyen Wanya, who is a health informatics advisor with Datafy. So please, with a round of applause, can we introduce Noyen to the stage?
Hello, everyone. Hello. I hope, like the other host has said, that we're not going to have any executive meditation. I welcome you all. Allow me to stand on the existing protocols. And to you, our honored guests, I welcome you. So for this session, we're going to be discussing on harnessing the power of LAMIS Plus suite of applications and its integrated features to improve health outcomes. So with me here, I'm going to have some members of the panelists. So we're going to be looking at a couple of slide presentation, taking us through the LAMIS Plus development process. Our lessons learned, I know someone had asked a question regarding the lessons we have learned in the deployment of LAMIS Plus. So we'll take a look at that, and we'll also have our panelists who would also share with us their experiences. So our panel session, our panelists are actually a mix of both the developers, because we're going to be looking at experiences from developers' perspective and also from the user's perspective, including our community of practice activities. So before we go into the presentation, I'll introduce the panelists who will be working with me on this session. I'll be calling on Chukwemeka Ilozwe. Chukwemeka Ilozwe works with Palladium Datafy. He's a senior backend developer at Palladium. Please, can you appreciate him as he comes up to stage? Okay, thank you. So the next person I'll be calling on, Winifred Okafor. Winifred works with Center for Clinical Care and Clinical Research Nigeria. She's the Strategic Information Advisor. She'll be joining us on stage. Please appreciate her as she comes on stage. We're also going to have Mr. Tolu Adishegiri, who works with NASCAP, FMOH. He'll be joining us on stage too. Please appreciate him as he comes on stage. I'll also be calling on Anana Aristotle. Anana works with Excellence Community Education Welfare Scheme, ECUS, as the Strategic Information Advisor. Okay, our next panelist is Victor Ajo. Victor works with Palladium Datafy as a senior front-end developer. We'll be hearing from both the developers who have actually contributed to the development of LAMIS Plus. And then our final panelist, who is no other person but Madam Chika Obiora Okafor should be joining us on stage. Please, a round of applause for her, please. Thank you. So today we are looking at two critical aspects in the evolution of global health informatics and digital health systems that addresses the challenges, the integration and interoperability standards, and the Global Goods Initiative, along with the Community of Practice implementation model. And before we go into the panel session, we'll just take a look at our processes, all the activities that went on in the development of LAMIS Plus as an application, as an EMR, and also we'll be hearing from our panelists on their experiences, and also they'll be sharing some insights as to how we can also improve on the existing system that we currently have. Okay. So first, we'll be talking about the USAID Digital Health Vision. Why we're going to start with that is because that's like the benchmark or the guiding principle to which LAMIS Plus EMR was developed and built. And the USAID Digital Health Vision looks at 4 areas, which is one, it looks at in-country investment. So they provide support to partner countries to build capacity to both the host government and also build capacity on workforce capabilities. Then there's also the strong national digital health strategies and cost implementation roadmaps, where they support host countries to provide organizing frameworks that aligns with the funders' investment in digital health. And then there is the National Digital Health Architecture, where they provide and work with partners and in-country to organize frameworks, develop frameworks that can be used for system integration, system interoperability for different digital health systems. And then there's the global goods. When we talk about global goods, we're talking about content or solutions that can be reusable, that can be adaptable at different resource areas. So that is also one of the digital health vision, which was used as a benchmark in designing the application called LAMIS Plus. Now we go into the history of LAMIS Plus. So just a bit about how LAMIS Plus came to play. It was formerly known as LAMIS, which is an acronym for Lafia Management Information System. Lafia, which means health or well-being in about 4 or 5 different African languages. And I know we can recognize one, which is our in-country Hausa language. LAMIS was the first version of the LAMIS Plus suite of application, which we'll be talking about today, which was designed under the USAID GAIN project by FHI 360. And the LAMIS Plus is an offshoot of LAMIS, which is built to be patient-centric and a most robust modular application, which is also compliant with standards to help improve patient care. In the design of LAMIS Plus as an application, we brought together interdisciplinary teams. So it's been designed by a group of health informatics enthusiasts, strategic information specialists, including the health programs and healthcare administrators, who collaboratively worked together to improve upon the system and currently are working together to make the system a global good resource. So like I said, the LAMIS Plus system is a modular architecture. It's a modular system, which means it can be designed for different health domains. It can be built to serve different health settings, where you can call it a plug-and-play system, So based on need, based on the different resource setting, you can design your application and then plug it into the LAMIS Plus for use. We have the LAMIS Plus that can be used at different settings. It can be used as a point of care system and also be used to document client records retrospectively. So when I say point of care system, it means that it can be set up at different health settings and used to provide real-time service delivery. Currently, we have it deployed in about 620 facilities across 17 states in Nigeria. So we have some key features which we'll be looking at today. Some key features we have built on the LAMIS Plus application. One of it is it being a modular architecture, like I have mentioned earlier. We have about different modules currently designed on the LAMIS Plus application that can be used for different settings, like I've mentioned. And then we also have the interoperability features, where the system can actually be used and interact or be integrated with other systems, other digital health systems. So we also have the system feature which supports clinical decision support, and we also have implemented robust validation rules for data integrity and data quality checks. The system supports program reporting. We have about 15 program reports that can be generated from the system, and also we have the system aligning with global standards. So some of the modules that we have implemented on the system, we have the core modules, which is more like the patient module where you register clients as they come to the clinic or health facility. We have the appointment and admission transfers module. We also have the consultation module to support outpatient department services. And then we have the laboratory module and the medication prescription or pharmacy module, as you may call it. And then we have data visualization and reporting module on the application. So for some of the treatment services which has been implemented on the system, we have the HTS, which is the HIV testing services, a module that can be used to provide testing services at health facilities. And then we have other treatment service modules that has been implemented on the system. So I've also talked about the integration, which has integration features which the LAMIS Plus has. And then we have the administration module. So looking at some of the features or modules that we have implemented on the system, one of it is the machine learning module, which supports clinical decision support for healthcare and administration in the health facility. This machine learning module actually helps in calculating risk scores to identify clients who are at high risk of being infected with HIV. So we'll talk more on some of these features during the panel discussion. And then we go to the system solution architecture. That shows us a bit about the integration process and the systems that have been integrated with the LAMIS Plus. So we have the LAMIS Plus being integrated with other systems like the Lab Information Management System, the LIMS. We have it integrated with the National OVC Management System. And then we have it integrated with national or global standards like the FHIR HL7 standards. So what the HL7 standards does, it's a framework, a tool that can be used to exchange patient health records in a secure manner, in a secure way. So when we talk about digital health, the first thing that comes to mind is usually data security and data privacy. So that's why it's very important for us to ensure that we put in place secure frameworks and architecture to ensure that patient data is safe and is confidential. So we also have LAMIS Plus integrated with the National Data Repository and other digital health systems. So in the course of our development and engagement and deployment of the LAMIS Plus, we had a lot of engagement with stakeholders in country, including the Federal Ministry of Health, NACA, NASCAP. We had engagement with other implementing partners as well. And so this was one of the processes that made LAMIS Plus deployment a success, which is in engaging partners who contribute directly or indirectly to the LAMIS Plus application. So we talk about the journey of our deployment process. We ensured to follow standard and best practices in the deployment of the system, of which one of them is ensuring that quality assurance processes were done at different levels. We had robust internal quality assurance process done on the system before it was deployed to the health facilities. And even as it was deployed to the health facilities, we had different versions of the system go out. We had the alpha version go out to the health facilities, which was as an avenue for us to gauge the use of the system in real-life scenario. That way, we were able to gather feedback from the users and made improvements onto the system for the go-live deployment. And then we had it scaled up to about 617 facilities as at December 2022. So as one of the applications which is built for LAMIS Plus use, we have the mobile application, which is a lighter version of the EMR that is used to support community-level patient care. So it's used at the community level to collect patient records. So we have the LAMIS Plus mobile currently in use and deployed at different health facilities and at the community level as well. So just to speak on some of the implementation on LAMIS Plus, which one of it is in the security implementation, what we have also done is to ensure that we comply with security policies and guidelines. We know that in country we have some agencies who actually support and ensure that data security is upheld. One of it is NIDA, so we've actually come up with different standard operating procedures to guide the users and the implementers who use this system to ensure that the data which is being collected from the patients are secure and are confidential. We also have implemented access controls on the system to ensure that there are no unauthorized access to the system to avoid any data breaches. And then we have implemented data encryption onto the system as part of our information security controls. So in terms of support, for every system that is being deployed or developed, there is need to set up or establish an efficient support system. So we also have established a help desk support system that enables users to log their issues and interact with our support team on any issue that they are either having, whether it's a bug or an issue, or need capacity to use a particular feature or not. And then we have that in place. And then we also conduct frequent training. We've also set up a webinar series for users when there are updates made onto the system. And then we conduct monitoring visits to also improve the system and identify areas for improvement. So in the course of this whole process, in the course of the development, in the course of the deployment, and also the monitoring and managing of this system, of course, we've actually encountered challenges which we were able to learn from. So we've had lessons learned from these challenges to improve on our processes and also to improve the system. One of it is in the system governance. Because of that, we've been able to establish the community of practice, which I mentioned earlier, where we have a group of people who come to share lessons for improvement and also share knowledge based on best practices. We have the different teams who also support in the development of this system and provide guidance on features needed for improvement, features needed for use at the health facility level. We've also had to develop guidelines and ensure that we're compliant with both national and international guidelines in the development of the system. And then we've also set up a change management and version control management of the application so that we're able to track these updates based on best practices. Another challenge was ownership. You would also agree with me that whenever there is a change, there is also resistance to change. And so we ensured that we carried all the stakeholders involved, be it the users, be it the implementers, or even the government of Nigeria involved, to also ensure that they are part of the workflow processes and also make their inputs in the improvement of the system. So another challenge that was encountered was on the data migration and adoption of the system. So data migration is one aspect that also requires the migration of data from the existing or legacy system to the LAMIS Plus. So we were able to provide adequate technical support. And also through the help of the community of practice, we had teams who supported the migration process and supported the use of the system at different levels, and also provided feedback for improvements where they were needed. And then we had a robust documentation available to guide the use of the system, to guide the different users at different levels. So just to summarize in our achievements, so currently we have a wide-scale adoption of the system, both at the community level. And then we've also had improved features of the module, like I mentioned earlier. We also have we have the ongoing training and support being provided to the users, and then we have the system integration feature, which has been implemented and also is to be improved as we implement and use the system. So looking ahead, in the management and use of the LAMIS Plus, the plan is to have global adoption and utilization, make the system global friendly, that can be used at different settings, even outside the country, and also improve on some of these features that I have mentioned. One of it is the clinical decision support feature, and also have some advanced analytics that can be plugged into the system so that it's user-friendly and it's also adapted or adopted at different settings. And then we also will be expanding the community reach to involve other industries. I know we've also started this process where we have students who are also part of the community to contribute to the development of the system. And then they can also learn real-life experience in the development process and the use of the system as well. And then customizing the system to be more user-friendly. Thank you. So I think so we'll go into the panel discussion now. So for our panel session, we'll be looking at the user and developer's perspective on improving health outcomes and also in line with the use of LAMIS Plus. And to my humble panelists, I welcome you all to this session. It hopes to be an exciting session, so we'll hear from your perspective and experience in the use of LAMIS Plus or the management of the system. So I'll ask the first question to Victor. So Victor, can you please share your insights as to the development and deployment process of LAMIS Plus? As one of the developers who support the development of the system, it would be nice to share your experience with our humble host guests here, so they also understand what went into that development process.
Okay. Thank you, Noria. So I think the development of LAMIS Plus has actually been an interesting journey. Okay, it has actually been a very interesting one. I would like to break it into 5 perspectives. The first one would be the goal. So for the team, we had the goal of building a platform that was user-friendly, but has the power to actually empower health practitioners to ensure that they actually give out good clinical services effectively and efficiently. Now, I also speak to the development process. It has actually been all around collaboration. Collaboration with health practitioners, collaboration with our partners, collaboration with the users. And then I'll go over to some of the features we have on LAMIS Plus. On LAMIS Plus, we have a comprehensive data management system. We also have a more broader decision supporting tool that actually enable people to actually analyze the data. You as well have interoperability, which you actually mentioned of. We have been able to link LAMIS Plus with the NDR, link LAMIS Plus as well with LIMS, and so link LAMIS Plus with the DHIS2 where we send aggregate data, as well as link LAMIS Plus with NOMIS, which is an in-house system as well. And the beauty thing about LAMIS Plus is it's able to welcome any other system because it's modular and it's scalable. Now, I'll also go over to the deployment phase. So the team actually came up with a strategy, and that had to do with deployment in two phases. The first is the alpha release, and then the second is the beta. So on alpha release, we just select a certain few of facilities, then put the system to proper use in real-world scenarios, test the system, and then when we get feedback, we modify the system for proper use and send it through beta testing. Now in beta testing, you now have proper documentation alongside, you now have TOT trainings going alongside, you now have routine monitoring visits to see how the systems are doing, you get more feedbacks, more modifications are made, and then that is it. So this is actually some of the strategies we actually put in place to ensure that the process around developing LAMIS Plus was very effective and user-friendly, and it actually empower the people at the facility level. Thank you.
Thank you, Victor, for that response. I think I'm sure we can take questions after the session. So the next question goes to Anana. Anana, you're part of the collaborators and contributors to the development of LAMIS Plus, and also part of the community of practice for LAMIS Plus. Can you please share your experience in the contribution and development process as part of a member of the community of practice?
All right. Thank you very much, Nani. Before I go to my own question, right, you've mentioned something in your presentation, and also Victor said something in his response, right? I also want the audience to know this. We speak about LAMIS Plus being modular, right? I think it is more than it being modular. What we've developed and the architecture of which it is built on is extension-based or something you call plugin-based. I'll give you an example. We all use our operating system, right? You can easily install application to the operating system, but the application was never part of the design of the operating system, right? So that's what we have tried to do in the architecture of LAMIS Plus. That's why we can confidently say, you bring in what you have, LAMIS Plus is going to take it, because there are several extension points in the application that your plugin can extend and provide its own data collection platform into the application. Thank you. Then I move to my own question, right? All right, thank you. Yes, contribution in the community of practice, yeah, it has quite been challenging and rewarding. I'll put it that way, right? Challenging in the sense that at the point in the community there were variation in how all these pieces can be put into place to get to where we are now. Rewarding that we have gone past that. I think we have a common understanding of what the goal is and how we want to go about it. Right? The community is working. We've set up, I think, one of the big achievements and win is the way we have been able to collect issues from facilities, migrate it back into the several parts of the community to deliberate, coming back to the developers part where I think I'll speak more, right? We incorporate those features, and yeah, it's really been good and helping. Thank you.
for that response, and it's actually been a rewarding experience. It's been eye-opening. I think we've actually, the Committee of Practice has actually grown from when it was established, and that is also, would also give that to our funders, who has also supported us, and also the implementing partners. So we'll take the next question, which is for Winifred. As an implementer, using the LAMIS Plus to support facility level utilization, what are some of the key benefits you have observed in terms of improving health outcomes?
Okay. All right, thank you, Naya, for the question. So speaking from the implementer angle, right, I would like to break it down into looking at it from the facility perspective, that is the end user's perspective, and also at the implementer as an IP at the IP level. So looking at it from the facility level, it has granted service providers access to patient information, like they have access to patient data, historical data over time, that they can monitor and also manage their clients very well. Also at that facility level, looking at, like you talked about the models implemented on the LAMIS Plus, looking at the appointment or the report generation model where we have the appointment system scheduling and all of that, it has actually helped when it comes to, if you're looking at the second 95, ensuring that our clients are retained in care. It has helped in the patient appointment scheduling and managing. Not just that, because patient scheduling and managing of clients that are on treatment to ensure that they are called at the right time by different service providers at different points. Also, when you look at the viral load monitoring of our clients, it provides that avenue to ensure that for every client that comes to the facility or is being tracked to come back to the facility, there's this streamlined level of service provision by the service providers for those clients. So it gives that avenue for that, looking at it at the LAMIS Plus and then the dashboard. Then at the IP level, I want to say, just like you mentioned also, that we have a lot of reports on the LAMIS Plus that has actually helped our work at the IP level also. I'll call it let me look at the RADET file itself. I'll call it like a one-stop shop where it gives you all necessary data that you need to manage your client, looking at the second and third 95. Because you don't really need to be at the facility to know what is happening for each of those clients or at the facility level, because at that implementing level, you're able to have access to this data. You can run your analysis and see what is happening and then provide prompt feedback back to the facility team. So I think that's actually helped in improving patient management and outcome over time compared to when we are doing the paper-based. But with this implementation of the LAMIS Plus, there's been significant improvements when it comes to patient management and monitoring across board. Thank you.
Thank you, Winifred. And thank you to lovely panelists who have spoken. We've heard a lot about the benefits of the system integration. We've also heard a lot about the development and deployment of LAMIS Plus and its use. So we'll take questions on the integration now and interoperability processes with digital health. So I'll ask Emeka, can you tell us more about the integration and interoperability standards that have been implemented on the LAMIS Plus EMR, as you're also one of the developers who support the development of the system?
Okay, sure. So in LAMIS Plus EMR, we have two significant standards which we have implemented. So we have the HL7 FHIR for API-based data exchange. It's actually basically patient-centric. Then we also have the ICD for standardization and classification of diseases and the cause of death. So these standards have been implemented in the LAMIS Plus that allows for exchange of data. Currently in LAMIS Plus, we can exchange data with the NDR, and also we have the linkage with the NOMIS application, NOMIS for OVC. So these standards also allow for us to be able to move data across systems. So this helps us not to have data silos and also redundancy and reduction of error. This actually may impact on the patient outcome. So basically, LAMIS Plus allows us to exchange data. By us implementing this standard, we're able to exchange data between systems we have. Thank you.
Thank you, Emeka. Okay, thank you, Emeka, for those responses and also letting us know what interoperability standards have been implemented on the LAMIS Plus. So I'll go to the next question, which is for Chika. Please, can you tell us what improvements you see that are necessary for the community of practice to enhance its effectiveness?
Okay. Thank you. I think before I start, I will just say, listening to my fellow panelists here and the great minds that we actually had that form part of that community of practice, I will just toe the line of saying that it has really been very rewarding. It's so good to hear this from them, because I know when we actually started this process of ensuring that we're optimizing this product, I will say that I will coin a phrase of mine, that a product is as good as its usability. Because gone are the days when we had geeky minds. Sorry. So the developers or programmers, they just do some information gathering and then come up with a possible solution for you that should serve a need. But the user's acceptance of this particular product may not be actually what that user actually expected, because the developer does not use it, is not experiencing the healthcare, the service delivery, or the process of service delivery to actually appreciate that this solution could actually work this way or the other. So I will say in how the community of practice has evolved from us as a donor when this was instituted, it has really been very, very rewarding, because we saw a platform where great minds, people with great expertise in their different fields, you're putting together a healthcare practitioner, you're putting together a healthcare provider on the field, you're putting together an implementer, you're putting together the programmer himself, the program designer, and also policy developers in the same room, trying to ensure that we're building and providing a solution that is able to meet all the health challenges. It's really been very, very rewarding in seeing how this community of practice has actually built the LAMIS Plus, and not just LAMIS Plus, we have other products out there. So we have the NOMIS community of practice. I would say that putting together key stakeholders on the table to discuss, problem solve, and actually prefer a solution that can be used is very, very essential. Just putting out the product there is not just it, but having those great minds that can actually tweak a situation to make it as functional as possible to solve those health programs is very, very, I would say it has really been very, very rewarding. And I would say that how do we make it as effective as possible? The way that it has been running, bringing these great minds together, sharing their expertise, sharing their ideas, and building a solution that works is key. However, to ensure that we are progressing, to ensure that we are meeting the right needs of that health solution, communication is key. So in the community of practice, we have different minds. So we have the developers, so there's a health informatics team, but they are not just the ones that are providing that solution. We also have, did I say something? Sorry. We also have the program folks that are there. And with LAMIS Plus, where we have integrated a lot of program areas, it has been evolving to ensure that in the HIV and AIDS space, we're meeting the needs for testing, we're meeting the needs for making sure that people are placed on treatment, we're meeting the needs of viral load testing, we're meeting the needs of ensuring that pregnant women are identified and put on treatment. that is a very robust system. And to get that robust system work, you also need programmers that are experienced in that field to actually provide the necessary inputs. And so communication is key. Knowledge sharing is key. So in that committee of practice, we've been able to put minds together and ensure that the experiences learned in different locales. So we're saying that we're implementing in Borno, we're implementing in, say, Sokoto, we're implementing in Rivers. The way the program works in those areas differ in their different respects. But if those minds come together and provide experiences that they have gathered to make the health sector better, that collaboration, that communication, that's the need to ensure that we're providing the necessary tools to optimize the system, irrespective of where that system is going to be utilized, is very, very key. I would also say that we need to continuously engage, not just engage within our local sphere, I will say Nigeria, but there are community of practices that have evolved beyond a particular location. Take, for instance, DHIS2 is an open source software. DHIS2 has rubbed minds across countries, across different spheres. And so when you have experience sharing beyond your current location, you're able to maintain industry standards. You're able to ensure that the standards that are infused in that particular product you're ensuring that it's meeting the right standards, and you're building upon it from time to time. So I would look forward to a situation where the committee of practice does not just stay at the level that it is, but is continuously engaging with people outside this current sphere. Let there be that continuous engagement. And then not just that, as engagements are occurring, we're actually building our capacity to ensure that we're learning from experiences from elsewhere and infusing it into the products that we're currently putting out there. So thank you.
Thank you. Thank you, Chika, and just to use this opportunity to also appreciate USAID for their support. They've been really supportive in the whole process, development, deployment, the community of practice. They've showed a lot of support to the team and the community members. So we'll take the next question to our government representative to let us know what role the government through NASCAP, because we work a lot with NASCAP, is playing in promoting these integration interoperability initiatives at the national level.
Thank you very much, Noya. It's very beautiful to respond after listening to the panelists. I mean, there's very few to talk about. The government plays the front role in the sense that we create policies, we create guidelines that meet international standards, and then it's obvious that LAMIS Plus was created in line with these policies and guidelines that were made. Yeah, thank you.
Thank you. So there's always, in every innovative process, in every innovation, there are always challenges that we encounter. So we'd just like to hear from some of our panelists, some of these challenges, they have experienced in this whole process, in the deployment, the development process, in the interactions, in the support that has been provided to the users, and also support being provided at different levels. So Emeka, can you also tell us what are some of these challenges that you might have faced during the development and the deployment of LAMIS Plus?
So thank you for this question, Naya.
Maybe, I don't know if they can hear you clearly.
Okay. So this quite interesting. So one of the challenges we encountered while developing LAMIS Plus was during the migration. How do we integrate LAMIS Plus to the existing system? So as you said earlier on, there was a system, which is LAMIS, and we wanted to upgrade, and LAMIS Plus was coming to do that. So what we did was we worked closely with the implementing partners and stakeholders in order to build a robust migration tool that is capable of migrating data from the legacy to the LAMIS Plus EMR. So, and additionally, we also prioritize user feedback. So we'll carry the user along throughout the migration process, iterating and redefining features where necessary. And also, after the migration, issues with system use, because change, it's not usually a comfortable thing. So we had to do a training in order for us to get various stakeholders to use LAMIS Plus.
Thank you. So while we're talking about these challenges, I don't know if you can also tell us the challenges you foresee in the widespread adoption of integration and interoperability standards in healthcare systems. We've recently been talking about interoperability, data exchange, integration. So can you also tell us what challenges you foresee in ensuring those standards are also being integrated into our healthcare system?
Yeah, so there are many standards. So with many standards comes different terminology, different protocols. So getting to actually fuse all these two together can be an issue. Then and also we have various health care systems. So and in this healthcare system, they come with different architecture and also infrastructure. So getting to fuse this system together can also be another issue. So to address this challenge, we need to train and retrain and also be able to provide resources. Then I said earlier on that change is usually an issue. Healthcare providers and stakeholders may be resistant to change in the sense that the standards are coming to disrupt the existing workflow. So we need to let them know that this is actually going to be beneficial in the long term. So, and also we have issues with data privacy and security. These standards should comply with local and international regulation while maintaining the integrity and confidentiality of the data that is also being shared. Thank you.
Thank you. Thank you very much to all the panelists for those wonderful insights on our experiences and also sharing some insights to how we can better improve our engagement and even in the development process of this system and also in the engagement of other stakeholders. So I think we can take questions from our audience. Okay.
Thank you very much. It's a very interesting discussion we're having. From the last speaker now, I just want to really tell us what are the processes you have put in place in terms of the privacies and the security and integrity of the data being exchanged on those platforms, just for us to really know. Thank you.
Okay, thank you, sir, for this question. So in the aspect of data privacy, so most of these protocol, you don't share PII. So basically for FHIR, when you share patient-centric information, we don't include PII. That's the standard for FHIR. So even if the data is out there, but it's not tied to anybody. So, and for data security, we have various means which we had used to safeguard data in the sense that we also have data encryption on transit. So when data is being shared, you don't get to be able to access that data. So for the standards, they ensure that data is protected even when data is shared. There are some of those ways we're able to implement data privacy and security.
Just to also add to that, there's also the access control. So access is only given to authorized users of the system. So that's also another way to ensure data privacy and data protection. Thank you. Do we have any other question? Okay.
All right. Thank you very much to all the panelists. I'm NASCAP Health Informatics. So my question goes to us. I would like to know what are the open source license standard you intend to conform with regard to LAMIS Plus. Like you can see some software have been developed or funded by organizations and they might adopt Apache license, MIT license, GPL. So do you have any plans to adopt anyone for the sake of sustainability and also community involvement? Thank you.
So Victor, do you want to take that?
All right, so thank you. Some of this license we are actually looking at, so just as you mentioned, you have the Apache, MIT license and so forth. But before you adopt a license, you want to look at the pros and cons to see how you want to safeguard the software as much as it's open source so that you don't have alterations where you notice to be alterations. And so I can categorically tell you now this is actually the license we are going with, but we have actually taken a number of licenses out and we've actually considered the pros and cons and then we'll adopt probably one. But one thing you should take a note is the source code is actually open source. And if a source code is going to be open source, definitely there's going to be a license to it. Thank you.
Thank you, Victor. And then I see you nodding your head. Do you also want to add to that?
No. Victor just said it all.
Okay. Thank you. Do you have any more questions?
Okay. Thank you very much, panelists. I'm Sheon for CCCRA. So my thinking is, of course, LAMIS Plus has been very helpful in monitoring patient outcome and all, especially beyond the facility level. So I'm thinking, do we have a plan? Maybe it's already in the pipeline, or what? Maybe we can look at making it effective at facility level in the sense that the clinician can actually use it, because we still depend on paper-based for the facility to have interface to it. And we know the disadvantages, the limitation of this paper-based. We have patient history already out of the folder, and the clinician actually has to use this paper-based to make a whole lot of decisions. So I'm just thinking in Nigeria, if at some point we can actually have that implemented in LAMIS Plus. Thank you very much.
Okay, thank you for that question.
I was expecting that the geeky guys would say it. Okay, so Sheon, I would really like you to be part of the committee of practice because you have some insights into what the plans are. It's not something that can be done in one day. However, we actually have a point of care system currently we finalized the development, but we're just about to deploy. We actually are aware of the resources that are involved, and that is why we are actually advocating for a lot of engagements with the states, especially for sustainability. There have also been discussions with some facilities that already have their own EMR systems and that want to now integrate. So we have one integrated system within the facility with an existing open EMR system that the facility uses alongside the HIV system. And so with that, when you're able to merge those systems together and include a point of care system, ensuring that the clinicians are able to, at their own point, actually enter their clinical records, they are seeing the clients. There's also, we're also going to be implementing, see me talking as if I'm a LAMIS developer. Okay, so we're also going to be deploying or implementing reports or historical reviews on the client on the system. So with the point of care, the clinician at the point of seeing that client is able to have the history of that client already and is able to make inferred decisions on what next line of action to take. So that is in the works, but definitely we would also, with minds being rubbed together in the committee of practice, we would also want to know how we can make that better. But we're mindful of the resources that will take, because that means you would have to deploy it on probably tablets or on Android devices for it to be more accessible, or you can even have computing systems at each service delivery point, so that when the clinician is actually seeing that client, clinician is documenting. It's available already. Take, for instance, in Federal Medical Center in Abuja here in Jabi, they have gone purely digital. So having a kind of collaboration with that kind of health facility, it already makes the, that seamless integration possible, because already within their own EMR system, they are affording that kind of care where the clinician is seeing that client, or even at NISA or other. But when you go to the rural areas, it's kind of difficult. So, but we know that with time, it's evolving. We're not there yet, but having that point of care deployment at least is the next step in ensuring that we can get that rolling.
Thank you. You're speaking like this because you really want to give us the money.
So,
okay, thank you very much. Yes.
Let me say something
Okay.
from the developer part, right? Okay. So I just want to let her know that the current state of the LAMIS Plus can be deployed POC if you have the resources. So if your IP have the resources, go ahead. Buy systems, buy a good local server, train those people, clinicians, lab guys that are going to use it, create user account for everybody to be accountable for who entered a particular record. You're good to go. Thank you.
Thank you. Thank you, Anana. So we take one more question.
Thank you, panelists. I have two questions. I think one has been partially answered by the person that asked the last question, which is, are the users, not implementers, are the users part of the community of practice so that there's direct engagement with the developers and the implementers, and you get their feedback and you can use that for improvement of what you're developing. And then this is specifically for Chika, or USAID. You actually talked about the future of LAMIS in relation to DHIS being across countries. So what is the plan, or is there a plan to take LAMIS across, maybe starting with West African countries, perhaps even starting with including them in the community of practice? Thank you.
During the presentation, I think Noye actually mentioned it. So we are positioning LAMIS for global good. And to be able to get that to where we want it to be, there's a process. We're currently engaging with
Digital Square,
Digital Square to have a review of the current LAMIS infrastructure, the current LAMIS structure, to be sure that at least it meets global standards. Once we get a veto from them, that we can carry it beyond them. It's definitely in the works. We do not want LAMIS Plus to just be used by Nigeria. When LAMIS 3 actually started, before we now evolved to LAMIS Plus, of course those engagements were there, but definitely in the health informatics space, you also need to ensure that you're well patented, you're correctly verified, that your product meets international standards, and then you can now carry it out there. So that is in the works. We're supposed to be finalizing on that in the next few weeks. So once we get that done, there are already engagements with other countries to see how we can actually scale this up. But not just in scaling it up, even as we're working within the community of practice, we know that this has just been designed for now for the HIV space, but we're talking, there's so many things, there's so many parts that are now being put into LAMIS Plus. LAMIS Plus, you now have a module for COVID, you now have a module for immunization, you now have a module for mental health, for PrEP. So there's so many things. So as a community of practice is also working to ensure that it's optimizing it for use. And you also asked whether the users are also involved, and yes. So the community of practice involves not just the healthcare workers themselves, the implementers themselves, the programmers So the program designers, we pick people that are in the clinical space. So the lab focal person is there from the different implementing parties, even USID, even other donors, to ensure that we have minds that are specialists in their own field that would actually contribute to the optimization of that particular piece. As we're working with LAMIS Plus and ensuring that it's optimal for global good, we actually have other EMR systems that we're also working on, NOMIS in the OBC space. So by the time we tie all this together, within LAMIS Plus and NOMIS, we're also ensuring interoperability so that you're not just treating a child in the space of clinical care. You're also ensuring that the other services that are provided to that child, you're able to trace longitudinally. Same with a pregnant woman, so that all the services the client is receiving, you're able to track longitudinally. So all these are in the works, and we intend that as we build it and optimize the system, it's usable elsewhere. There are some countries that don't have an EMR system, and they're begging for an EMR system that works and they're able to deploy.
Thank you. Thank you very much for those wonderful responses and comments to the question. So we have come to the end. Sorry?
Can I say something?
Yes, please, you can.
So, you know, Madam Chika just answered maybe the user side, right? And you know, in this form, we have developers and the user side. So, to also answer her from the development side, you know, I'd mentioned the architecture that was used in development, right? So, as a global good, there's also the housekeeping part to prepare for other developers beyond Nigeria that might want to also build plugins or extension points, right? They might customize it to do what they want, take the core application, install, right? So they will need proper documentation on steps, guidelines that you need to follow. So we also need to do housekeeping stuff on the development side before we fully present it as the global good, because you can't separate the user side, global goods, and the development side, global goods. Thank you.
Thank you. Thank you very much. So I don't think there's any other speaker that wants to say anything, because I think our time is fast spent. Thank you so much to all our distinguished panelists, and we have come to the end of this session. It was such an engaging session. You can agree with me on that. We have gained deep understanding of the technical innovations and design principles that support the development of LAMIS Plus, as well as the community of practice model and activities. Thank you once again to all our panelists for their contribution, and the participants and audience. As we conclude, I would like us to carry forward the insights and connections we have actually made today, including all the engagements and contributions, feedback and comments from both the audience and our panelists. So I think we end on this note, and thank you everyone for listening.
All right.
Please, let's keep jamming our hands until they get to their seat, please. I think we will all allude to the fact that was a very engaging session, and we must have learned a lot. But guess what? We still have much more for you to take home with. So, buckle your seatbelts. There's more to gain from. So before we move on to the next session, we just want to specially recognize some persons who joined us here. We have Dr. Miriam Kisakadi Umbaya from WHO. Please, if you're here, can you just stand up? Okay. You're welcome. We also have some persons from Akwa Ibom State, so I'll just quickly mention their names so that we could also welcome them with a warm handshake. Dr. Antia Etop, the DPH Akwa Ibom State. You're welcome, sir. We have Dr. Eme Osanga, the SAPC Akwa Ibom. Can you stand? You're welcome, sir. We have Madam M.M. Xavier, the PMTC focal person in Akwa Ibom. And we have Odwak Umo Odofia, SAPC M&E officer. You're welcome. We also have some dignitaries from Taraba State. So we have Dr. Garba Danjuma, the DG Taka. You're welcome, sir. We have Hajara Ibrahim, M&E officer, Taka. You're welcome. And we have Ande Akanta, SASCAP M&E officer too. Yes. So thank you. So we appreciate everyone here, and we'll just quickly move on to the next session. So the next session is on applying data analytic techniques for improving HIV clinical outcomes. And we have, to do justice to this, representatives from DataFi, S3, and USID. But before we delve in, we'll have a presentation that will usher us into the panel session. And to do justice to it, I'll be welcoming somebody, one heavyweight also, in the DataFi team, Ira Oj Carlo Jemere, who is a senior manager, data analytics and data use. So he would have a presentation first, and he'll usher us into the panel session. You're welcome.
Thank you. Okay, thank you so much, ladies and gentlemen. Permit me to proceed on the existing protocol. I know we are very, very much considerate in terms of timing. I will be brief as possible. So, while we look at the perspective in terms of digital health, we are also going to be looking at how we apply data analytics, the techniques towards improving health outcomes. One of them is looking at the HIV clinical outcomes. You will agree with me that for quite some couple of years, Nigeria has actually invested resources to mitigate the impact of AIDS, HIV and AIDS in Nigeria, with respective donors playing key roles in terms of these resources. But we'll be looking at some of the quick overview, how these techniques have actually helped to provide insight in terms of epidemiological insights. So one of them is the area of the disease surveillance, trend analysis, spatial analysis, predictive modeling, and risk factors identification. These are some of the areas you can use analytics to provide insights. The question before us is why data analytics? Why just collect data and just send it to where it's supposed to be kept? So there are some reasons and the benefits that applies to this. One of them is that it improves early detection of disease outbreaks by allowing public health experts to provide timely interventions to persons who actually are at risk at different levels. Another one, look at the real-time monitoring process of health outcomes and also monitor and track diseases at different stages. Early identification of risk population, the key population group, the pediatrics, the adolescents are also beneficial in terms of analytics. Also help stakeholders to plan resources to make informed decision. So quickly, we are all used to a lot of analytic tools, but just to mention a few, we have some that are actually very, very handy, affordable, and easy to use. We have spatial tools that range from R, statistical analysis system, SAS, the Python, and the Stata. So for geospatial analysis tool, we also have resources around the ArcGIS, the QGIS, that has actually been used in for most of our products. And also for visualization and dashboarding, we have the Tableau, the Power BI, the R-Shiny, as well as the Python. Like I mentioned, there are a lot of them, but these are some of the foremost ones that are actually being used within the public health space. So example of some of the robust data analytics systems that we've currently deployed to provide insights within the USAID implementation states. We currently have a system known as the Comprehensive Access and Review Dashboard, usually known as the CARD application. It's a web-based system that helps public health persons to gain insight in terms of data and also make a meaningful decision about the data that are being reported or collected at the facility level. It's a dashboard system that helps to bring or harness other analytics tools currently being in use at different levels. So also, you could see some of the reasons around the use of this CARD systems. For most importantly, the accountability and use systems in terms of the data use itself. Also, having interoperability between most digital or data analytic platform, like I made mention of some of them, the R platform, the Power BI, the Tableau, the ArcGIS, and the QGIS, and a whole lot of others. So it has that high level of interoperability across this analytic tool. And also efficiency for data use. You could see how stakeholders engage in terms of the use of the card at different levels. And also just to give you some snapshot of the card visuals and some of the key program areas that the card currently supports. We have the performance dashboard. We have the HIV dashboard. We have the line lister dashboard. We have the TB dashboard, the OVC dashboard, the gender-based intervention dashboard. We also have the biometric recapture, just to mention a few. And also looking at some of the key features that CARD currently has. One of them is the role-based access control that helps to streamline users based on roles and responsibilities within the aspect of visualizing data. And also, I talk about it's highly interactive with a lot of drill down across different level of aggregation. So it has a 360 integration, which helps to seamlessly have different multiple dashboards being integrated into the platform. And also, it's portable, or we refer to as mobile compatibility, that can help us to have even visualize this even on a mobile or a tablet devices. So this is just a snapshot of how CARD pulls data from different sources. Like I mentioned, it has a connection between the automated partner process reporting. We also have data pulling from dating using the API call. Also have data pulling from the LAMIS Plus, as well as also from the line lister. So these are some of the data points. It pulls data at different levels, and it helps us to aggregate them for informed decision making. Just to give you a snapshot on some of the performance management platform, a case study of HIV prevention, care and treatment measurement across the partners and also across the different stakeholders, just to give you a snapshot of what we have. And also across looking at the biometric recapture process. So these are some of the use cases that we have been able to demonstrate the use of CARD platform. So talking about the system as a whole, it's not just free from its challenges, even during the process of development, as well as also deployment. So some of the quick challenges that we encountered at the beginning of the development was the integration, pulling data from diverse sources. We have aggregate data from different platforms, Dateam, DHIS2, even calling data most often. So we're able to have some ETL tools that was able to help us to streamline data across different platforms. So also, one of the aspects is the area of engaging and adoption of these processes. We have a lot of persons who have needs and different views towards dashboarding. We've also been able to help to bring in different knowledge, different perspective towards development. One of the aspects we used was to be able to develop modules for training and also manual guides for navigating the system, and also help us to train users and inform users at different level of navigation. So these are some of the challenges that we encountered, although there are other challenges in terms of the development phase, but these are most prevailing ones that we're able to look at some point. But I will leave it at this point for the moderator, because we'll be having another section for the panelists. I'll call on Dr. Abba to introduce the panel. Thank you.
Thank you so much, Oje. That's indeed mouth-watering because we can only imagine what else we'll have to get from this session. So we'll have some other persons who would join this session with Oje. So I'll be introducing Dr. Austin Idebodia, who works with USAID. Please, a round of applause to introduce him to the stage. So we're also going to have Oyindamola Anthony Alimi, who works with S3 HSCL. Let's introduce him with a round of applause to the stage. We're also going to have Grace Ayod Jato, part of the panelists from DataFi. Please, Grace, round of applause. And the last person who will be here, who would also be the moderator of this session, will be Chisom Ohazurume from DataFi. Please, a round of applause. So while Chisom is coming, before I hand over the mic, please, I want to plead with us to kindly scan the QR codes on your tags so that you can fill the attendance, because we've noticed that so many persons haven't filled the attendance yet. So please, scan the QR code on your tags. If you look at your tags, behind it, you see a QR code. Please do well to scan and fill in the attendance sheet, please. Thank you.
Okay, so good afternoon, everyone. Standing on existing protocol, I just want to welcome you to today's panel discussion, basically on applying data analytics techniques for improving HIV clinic outcomes. So as we all know, HIV care and treatment requires multifaceted approaches, and data analytics has the potential to revolutionize the way we deliver care and services. So by harnessing the power of data, we can identify trends, track improvements, track outcomes, and make informed decisions to improve patient care. So our panel today, we have panelists who have experience, who are experts in the field of HIV care and data analytics. So they'll be sharing insights and their experiences using data analytics to inform decisions. So we'll discuss opportunities, we'll discuss challenges, and then best practices in using data analytics to enhance patient care. So I'll just go straight to the questions. Let's start with what exactly around power of data analytics, what does it actually do in terms of enhancing data-driven decision making? So I'll ask Oyindamola, so how can data analytics enhance data-driven decision making in HIV programming? And what are some successful examples that you could give around, this is some of the things that you do, so let's just hear from you. Thank you.
All right. Good afternoon, everyone, and thank you very much. So in terms of looking at digital health and analytics systems, which has actually given us an insight into all the data that we've actually been harnessing in different platforms. I will share my experience with connection of Lamis Plus product. We have the RADET, you have the HTS report for first 95, you have RADET for second 95, you have the lab reports too also for third 95. So in harnessing this, connecting a BI tool, I actually use Power BI with this data source that we have from, or let me say data products that we have from Lamis Plus, and also the APPR, which is a DHIS2 platform. Connecting these two together actually helped us to look at data and strategy development. For instance, with this level of data and the access that we had, we were able to actually break down the LGAs that we currently operate, which are non-permissive LGAs. So we needed to rank them into the green LGAs, which are very accessible, the yellow LGAs, which are semi-accessible, while the green Ls and the red LGAs are where we cannot access. So with this, looking at this data and shared with the stakeholders, we're able to sit down on a round table, develop strategies, specific strategies, and implementation plan to actually reach our patients or our clients who are currently residing in these LGAs. And also looking at this level of analysis and data visualization, we can see that we have high prevalence rate in the real LGAs. Why? Because we know that these are places where we have a lot of things happening in terms of, we have rape cases, you have gender-based violence actually going on in that. So we needed to employ residents in that LGA to be trained in those LGAs to be able to curb the spread of HIV. So these are the things that we have actually done, and this is what the data visualization has actually guided us in terms of developing strategies to actually improve patient-level care. Also looking at the predictive analysis that Mr. OJ spoke about, we're able to use this product to actually do a predictive analysis and create an hotspot using GIS mapping integrated inside Power BI to be able to see where outbreaks are likely to happen. And this has actually helped us to not only improve case finding, but also manage resources across all the LGs that we implement. Thank you.
All right. Thank you so much, Alimi. So, OJ, you made earlier presentations, and then you have a vast knowledge with data analytics. This is what you do on a day-to-day basis. Can you just elaborate on how data analytics can help identify and address potential bias in HIV programming? So disparities could be around treatment outcomes, retention, access to care. Just what are those strategies that have been successful in addressing these barriers?
Okay, thank you so much. So the analytics actually, the platform actually has given us an advantage. Looking at, you talked about disparities. One of the foremost analysis we conduct most times, even with the simplest analytics tool, is the gap analysis, or which we often refer to as the disparity analysis, that helps us tell us the difference between services at different level, and also that help us also to address those gaps. Not just looking at data quality, but also looking at in terms of shortage of services to maybe rural areas or a location where services naturally do not go to. Most times we also have some level of analysis that talk about the hotspot mapping, geospatial analysis, that also help us to identify location per time based on service that actually service delivered at those locations. I could also remember that in the last couple of surveys that have also been conducted nationally, that component also have actually been infused into those hotspot mapping, specifically for the key population bits, which also actually helped us to also look at where the epidemic is actually going in terms of those locations. But there are actually strategies that can help us address this. Most often, they are not widespread innovations, but mostly they are targeted interventions for those areas that are expected. Looking at the gap analysis, you could see how we have been able to identify where the challenges in terms of what strategies are best in terms of providing HIV testing services. There are different testing modalities, but you could see how the analytics platform has actually teased out this into bits and pieces. You could tell us clearly that index testing is actually more efficient in terms of testing, but there are other modalities that are actually doing very much well in terms of testing. So there are also other benefits in terms of resource allocation. You could see beyond service provision, the other part of has to do with logistics part, where transporting commodities to locations. You could also tell that it helps us to identify those locations that are hard to reach, where drugs naturally do not get to. So those are some of the benefit strategies. It's not a one-size-fits-all for all these challenges or risks that have been identified, but they're going to be tailored based on specific needs. Thank you.
All right, thank you so much, OJ. So I know that with the data analytics, definitely there are some challenges that would come with implementing data, with having the data analytics. So we'll just delve into those challenges of using the data analytics in HIV programming. So Grace, you also have knowledge, using the data analytics. So what are some of the common challenges and limitations of using data analytics in HIV programming, particularly in resource, constrained settings like we have here in Nigeria? Let's also talk about how these challenges can be addressed and, basically how you've been able to address some of them that you've come across. Thank you.
Thank you so much. So in Nigerian context, one of the major, or some of the major limitation, I'll start listing, one of the major limitation we have is we have limited infrastructures and technology and access to technology. When we think about the rural areas, the limited people, we also have people with limited capacities to use some of the developed analytical tool. We have limited human resources and capabilities. We also in the profession, that is in data analysis, we have data analysts and data scientists with limited health knowledge. And we have health professionals that have limited capacity to interpret data analytics. So that's like a two-in-one problem for human resources. We also have challenges around people that don't even want to change. They don't want that transition. They don't want to move from the analog system to the digital system. They are very resistant to the change. So these are some of the major challenges we have. For the technology aspect, DataFire has been able to go a bit lower, not necessarily lower, but we've stepped up in the sense that we've developed Lamix Plus Mobile so that it can be accessible, data can be collected easily, because part of the challenges with limitation of technology affects the collection. It actually affects the whole process of data analysis. It affects the collection, it affects the storage, it affects the analysis. So DataFire has been able to develop Lamix Plus Mobile to also help in easy collection of data. However, like someone mentioned during the Lamix Plus section, we have people that are still struggling with moving their data already in paper system to the digital system. So that's one. We are trying to see how we can encourage the use of the Lamix Plus Mobile so that they can easily enter data without having to wait till when it is entered in the paper system before they move it to the digital system. Also for the analytics, in terms of the analytics, simplifying, we try as much as possible to simplify the analytic product developed so that it can be easily accessed even on mobiles and also easily interpreted. That's one of the solutions we've found to that. Another thing that I also see is the capacity building. We try to meet with the local team, the state team, the partners once in a while to train and also to hear the feedback, to make it interactive. We train and then we also try to gain context. Like I said, sometimes we have the analytical skills and knowledge, and then we don't have the deep context of what is happening. And also context, it varies depending on location. The challenges that might be that they might face using the analytical tool in core north might be different from what they would face, even though in a local context in the western Nigeria. So meeting them also helps us to bridge that gap and also apply this knowledge into the newly developed analytical tools that we are churning out. So I think I've addressed the infrastructure, I've addressed the technology, I've addressed the human resources part. So majorly the challenges we have in the use of digital analysis tools in HIV sector is really complex. However, with the collaboration interaction like this and community of practices, I believe we are going to achieve great progress. Thank you.
Thank you, Grace. We've talked a lot around challenges, around limited infrastructure, technology, inadequate human resources, capacity, and all. So the next question will go to Austin. I would want you from the donor perspective to just give us insights, like how do you think the Nigerian government, donors, international organizations can support Nigeria as a country in building data analytics capacity and also addressing the challenges and limitations of using data analytics in HIV programming?
You hear me? So I think there are so many ways you can address the issues we have with data use in country. I'll just try to highlight a few. I think one of them, right, is that is the issue Grace just raised around capacity. You know, I think trainings and retrainings are very important. You know, a lot of people are living in the country these days. People are jackpotting every day, right? So even those that have been trained have gone. So there are new set of healthcare workers that need to be trained, both healthcare workers, data analysts, even policy makers on data use, digital tools, and all of that. So that's, I mean, seminars, webinars, training, all of that. I think government coordinating with donors and partners can definitely take a lead in that. Still on training and capacity, I would say is around, you know, maybe partnering with universities, online platforms, you know, to deliver certificate courses on data analytics, data use. I think that this can also be, it can be an incentive to get people trained. Still on capacity, I'm very huge on human resources, you know. Still on that is around skills development, beyond just the trainings. People getting skills on things that OJ talked about, on things like RO, statistical tools, and all of that. Or do they even have skills on maybe some kind of soft skills, things around critical thinking, problem solving, you know, even decision making using data. You know, you'll be shocked. I mean, how little people know about all of these. So I think that's a very big place that government, of course, working with donors, can really strengthen. The second one I want to touch on is something Grace mentioned as well, infrastructure and technology. So generally, you know, I don't think we have a lot of cloud computing or even interoperability around systems. We have LAMIS Plus in about 17 states. We have other EMRs in other states. We have laboratory management systems. We have logistics management systems. We have systems everywhere, basically, right? We have systems for HIV, we have for malaria, we have TB as well. So having the systems in country that can interpret themselves is one area government also can, I think, put a firm stand on. As well, I mentioned earlier, access to softwares, but even hardwares. You know, if you go to some facilities, you will see that what they have in those sites are systems that were bought maybe 10 years ago. And, you know, and of course, so I think it's an area where we need to get to, where we have government leading donors to actually make investments in upgrading hardwares. Again, data quality and data management. You know, our HIV data in the past few months has been under intense scrutiny worldwide. Of course, I mean, because of, it's still under scrutiny as well. So I think government making, ensuring that standards really across board. Earlier I told you that LAMIS Plus was built according to standards nationally. But what about the data source, data collection tools outside, right? Are they standardized across regions, across states, even across these areas, for example? There should be standardization across board. There should be people being deliberately taught on data governance, and all of those people in place by government. I will touch on funding. It's a key part because I work for a donor agency, obviously. So our response is, for now, mostly donor dependent, right? But we look at the point where we have sustainable in-country domestic resources for a long time that will take care of trainings, take care of infrastructure, and all of that. But beyond the support we get from donors, I think also having partners, like Palladium, the Jopigos, international partners really, that are able to transfer expert skills from global practices to local capacity, something I think will benefit the country also in the world. Just one more, sorry. I think as well, maybe if we also maybe were to work with government developing policies, maybe legislation laws that will maybe that will push or that will enforce us to ensure there's data quality, there's privacy of data, and all of that, And just to say, I think overarching of these will be collaborations, government working very closely with donors, with IPs, even with communities, because data has to be community-driven, it has to be culturally sensitive, and all of that, right? So I think if collaboratively we work together, government in the lead, of course, in the lead at local, federal, states, and connecting the partners, I think maybe in the near future, we should be able to have systems to adequately monitor, evaluate, and of course, improve our HIV interventions. Thank you. Chisom, over to you.
Thank you, Austin. So we'll just take questions from the audience. We are short of time. We'll take questions, I think 3-4 questions, and then we call it a day. You have any questions? Okay, so maybe while we wait for, do you have anyone? Okay. All right.
We have some questions submitted online, so I could just read them for the panelists. So the first one is, what are the ethical considerations using data analytics in HIV care, particularly regarding patient privacy and consent?
Oje, do you want to take that?
Okay, thank you. I think that is a very primary reason for the safety and security of the data. Like, let me give an example. Currently, for DataFi, we take that so dearly in terms of the use of data. I know, like my colleague actually spoke in the first session that talked about non-exposure of the PIIs in terms of accessibility of data, and also having that rule-based control access to give limited access to persons who actually are authorized, and also hindering access to unauthorized persons. Those levels of security have been put across our digital systems as well as the analytic systems. I will also give you, for example, the CARD platform is also helps to streamline users to specific dashboards. We have dashboard for OVC, we have dashboard for HIV care and treatment, we have dashboard for COVID-19. So there are persons within this program area that do not have access to other data or other visualization. So that strict rules-based control access as well as actually being enforced in this layer. So, and also, most of the digital tools are actually security conscious. We have the login application system that helps users to gain authorized access to those systems. Those are some of the security measures. Internally, there are persons who also have responsibility to engage with data. We have that non-disclosure agreement signed internally, and across the agency partners have also signed that non-disclosure agreement. Thank you.
Thank you so much for that. So we have one.
If I could just add to that, of course, you know that the government policies as well, on data security, ensuring that our systems conform with those policies and those acts is also an additional thing to do.
Okay, thank you so much for that. So I would hand over to, we have somebody here from the audience.
Okay, thank you. My name is Victor Agu. So my question is basically around issue of skill transfer to government. We know this has been, there's been this challenge around transferring skills to government and getting it to be retained within the government system. Basically because of the fact that oftentimes there are transfers. You build capacity of someone, hoping that the person will be there for a while and sustain the intervention. Within a short time, they get transferred and you have to start all over again. So I would like to know, and I also seen from the response of the response from the Federal Minister of Women of Health, so Federal Minister of Health in the morning, it has shown a strong collaboration between the TFI and the government around the HIV response. So also, I'll be happy to hear from the TFI and also panelists what approaches you use to be able to get that done and also ensure that these skills are retained within the government sector. Is from the federal down to state, we're having this experience. I think that would be great to hear from you what you're able to do to get this kind of result and also how we can sustain it going forward. Thank you.
Oji, I think you should speak to this. Thank you.
Okay, I will just speak quickly. I will use some of our states where DataFi has physical presence, Akwa Ibom, Taraba, and 8 other COVID-19 states. So in these places, there is a continuous mentorship, continuous training of state government. Let me give you an example. In 2019, when we began in Akwa Ibom, DataFi was actually anchoring most of the situation room engagements where we have data analytics and use meeting on a weekly basis. I could speak confidently to you that today, DataFi not necessarily need to be in that meeting for that meeting to hold, because we've actually built a system or supported a system that could be sustained even after the implementation phase of the project. Currently, as we speak, we also have the same applied to Taraba and other COVID-19 states that we support. The reason is that the level of resources that have been deployed to those locations have actually also considered those challenges that you may mention, movement of healthcare workers or even persons you have trained at some point. So there is actually an opportunity to train and retrain over and over again. It's something that's coming up clearly in terms of our activities that we conduct on a monthly and weekly basis within our program. Thank you.
Okay, Damola, you can add to that.
All right. Thank you very much, sir. So for the states we implement, USAID through HSCL on the S3 project, as actually, we have a dashboard that is automated, that is connected to the LAMIS Plus, that is connected to the DHIS, that is that where we collect aggregate data daily. So on this dashboard, it's inside the Ministry of Health. It shows you the key priority indicators and how your state is actually doing. So with this, we do retraining, just like OJ said, to be able to see that anybody that passes knows that, okay, there's a certain number of people currently on treatment in this particular state. So knowingly or unknowingly, what you see daily, enters into your system and it becomes part of you. So if you're being transferred, another person that comes will ask question, what is this for? Then the person that is available that, this is for this, this, and this. And that is how we've been able to actually build a sustainable system in the 3 states we currently implement. If you go to Sokoto, Kebbi, and Zamfara in the Ministry of Health, you'll see the dashboards there. Thank you.
All right, thank you. Any other questions?
Thank you very much as a rider to that, because I loved the explanations you gave around data use in the healthcare centers, and then what you said about the fact that when you saw a particular program after you have left, they still did it as if you were there. Now, for me, that is a good one. But then I'm looking at the humanitarian space where you have vulnerable children, the VC programming. In the hospitals, you would have a situation where those things could work because it's revenue generating, right? But in the VC programming environment, it is not revenue generating. It is revenue consuming. For us, we would always have these concerns at the grassroots level, particularly at the LGAs. Right now, I am waiting to see one LGA that is using NOMIS. I'm waiting to see ministries that were supported having these dedicated M&E persons there. We are having issues, but I really would like to understand how we can navigate with the way you did with the Ministry of Health, how we can also navigate with the Ministry of Women Affairs to state levels, particularly where we have this disparity in terms of the ministries that coordinate VC programming. Different states, you have Ministry of Youth and Social Development here, you have Ministry of Gender there, you have Ministry of Women Affairs here. So it's always not a one straight line jacket to all of these. How do you think we could leverage on possibilities in country as it relates to localization to get this done, such that because it's not revenue generating, if we do X, Y, Z, we can get it done this way and it will pan out fine. Thank you.
Okay, I mean, that's quite a tough question. So, one way I would look at it is perhaps to engage in advocacies, right? Because I think really this will start from government. Like I mentioned earlier, government has to coordinate. So to be quite frank, right, NASCAP, I mean, ANACA gave some good level of coordination in the HIV space, in treatment space, for us to have this kind of results, this LAMIS Plus. So I think the coordination in government, I think we need to meet some advocacy to see maybe where even assess, even to see where we can possibly assist from the government. Then I think it will generally just flow down. That's my thought. It definitely, we have seen it HIV, we have seen it in TB as well, and I think we can also see it in VC. The government has to have that coordinating role, my thoughts.
Are there any more questions?
Can I stand?
Yeah.
Thank you. It's a burning issue for us. I can profile some insights that I think may actually help. The core intervention of localization will help. But you know, in this instance, the health sector has this funding support coming in, coming out, coming in, coming out. Every other person who wants to get involved. For several circles, it's a security concern, so they want to be part of the system. But for vulnerable children programming, it's one in, out, one in, not there. It's like you are looking at a response that will not bring money. So we want to profile this. If DataFi can localize its presence through this infused collaboration, and by that I mean you have partners who have capacity to be able to sustain things at the grassroots level without necessarily depending on donor funding, leveraging on local resources. We've done it in the past. When NOMIS came out, when I think it was being driven by MSH back then, it was rolled out in several states, some persons rolled NOMIS at the local level, trained local government officers. Of course, attrition happened. They moved. But it did not continue because there was no support to make it continue. But if we have this localized infusion into the capacity that DataFi is building across country, we guarantee you that from our own end, as a civil society that coordinates, we'll be able to take what we have gained and ensure that at local government level, these things are happening. Not necessarily coming back to say, DataFi, we need your support again, but leveraging on what we have to be able to continue, just like he said, what you have started. Localization for sustainability.
Thank you. Thank you so much.
Thank you, sir. Thank you for that, sir. I think we're taking feedback, and I think therefore, I mean, as you know, also work with our OVC partners in all of those states and LGAs. So I think your feedback is a good one, and I think they can maybe better work with those partners that support those states to get those capacity transferred to the LGA and government folks in those states. I think. Yeah.
Okay, so just to add, we would also have an OVC focused panel session. So some of these questions, I believe, would also be answered during that panel session tomorrow. We have some other questions, but during the course of answering other questions, we've answered those questions. So I'll just hand over to the moderator to close the session.
All right, thank you all for your insightful contributions to today's discussion. We've heard from the panelists on how we can harness data analytics in improving treatment outcomes and getting the best out of it. We've also discussed around challenges. We've discussed around resource allocation and limitations and all. So as we move forward, let's just continue to see how we prioritize data-driven decision-making and innovative solutions to achieve HIV epidemic control in Nigeria. Thank you, everyone, and have a great day.
I think our panelists deserve a bigger round of applause. Please keep it going. Keep it going. Keep it going to the seats. A very big thank you to Chisom, Ohazurume, and the other knowledgeable panelists. We must agree that it's been very insightful and knowledge-filled. Thank you so much to every single one of you that was up here giving us very useful information about NOMIS and data analytic techniques. So I would love to use this opportunity to recognize a few dignitaries that walked in while the session was going on. So it's my pleasure to recognize Abdulsalam Abdulaziz, representing the Federal Ministry of Women Affairs, Director for Child Development Department. Please, thank you, sir. You're welcome. We're very happy to have you in our midst. And it's also it's a great pleasure to welcome also Dr. Oyeladun Okunromade, HOD Surveillance from NCDC. You're welcome. Is he in the room, please? Okay, all right. Well, he was with us for a few minutes. So just a reminder, please, our social media handle remains DataFi Project. Do follow us. We have a red carpet outside, and we know you've been taking beautiful pictures. So post them, tag us, use the hashtag DUF2024. You have it on your tag, DDUF2024. You have it on your tag. Tag us, post your pictures, and let's generate some noise on social media about this event. The next item on the program is lunch. We have lunch. Lunch will last for 40 minutes. After 40 minutes, we'll be back in the hall to take the last session for the day, and then we can call it, we can wrap it up and call it a day. So we can head out for lunch. I believe lunch is ready and it's served. Enjoy your meal and see you in 40 minutes. Thank you. You won't clap for me? Welcome back from lunch. Hello? Hello? I won't stop asking or saying hello if you don't respond. Hello? Hello? So your voice is louder than mine. Hello? Hello? Now that's better. Welcome back from lunch. I hope we enjoyed our meal. So without taking any much time, we would continue with the next session. And we'll be starting that session with a presentation on data use methodology case presentations from Akwa Ibom and Taraba Situation Room implementations. That presentation will be taken by Ayato Nelson Ngusha from DataFi. So please put your hands together as he makes his way to the stage. Can we please clap for him? I know we can do better. Thank you. We have this frame, this very beautiful frame. So if it's yours and you're looking for it, I know we just had a beautiful launch too, but in case you need your frames, let us know. We have it here. Thank you.
Good evening, everyone. I hope you are not too exhausted from the lunch break that we just went for. Okay, and the next session is going to be an interactive one. And through the support provided by USAID, and DataFi implements a robust and data use methodology. And one of the ways we've implemented that is through the situation room approach. In 2019, and DataFi started the first HIV situation room in Nigeria in Akwa Ibom State. And so this presentation is just to take us through how that methodology is carried out before I call on the panelists who will be part of this session. So DataFi maximizes the power of data to save lives. We currently operate situation rooms in Burkina Faso, Nigeria, Tanzania, Honduras, Guatemala, and Panama. So in Nigeria, we have 12 established situation rooms. 2 dedicated to HIV, that is in Akwa Ibom and then Taraba State. And Edo State was initially a COVID EOC, but recently has been integrated to have both COVID and HIV. And then we have the other across our EOCs focus across 8 states, as can be seen on the screen. So the concept of situation rooms that we've always heard about, what is a situation room? And situation room is just a space with the following features. One is technology enabled, and then there are standard methods for approaches, and then there's the rapid and corrective action plans that are implemented in those spaces. A situation room brings stakeholders together, people of like minds, people with a common interest, where they get to sit in a space and get to discuss, bring out corrective actions plans, propose them, and see that change ideas are greatly improved. And the goal of this is to achieve a culture of data use. In trying to achieve a data of culture use, what they would do, there are multidisciplinary stakeholders identified and commit to data use. Data use team meets regularly and documents action items following analysis. So every week, compelling visualizations are being made. We have the API, which is a platform through which we present, and we also augment that with PowerPoint slides where deep dives are done. And stakeholders are able to go through all of this and understand what root causes are and propose corrective action plans. And then there's accountability action, regular monitoring of outcomes and adjustment, like the PDSS cycle running and all of that. There are additional QI topics. So there are 2 aspects of this in summary. There's a hands-on support from DataFi, and then there's the government assuming leadership from the state of the government. So in all of our states where we implement the HIV or the COVID situation room approach, the government is one that takes this leadership, and DataFi supports to build our capacity, and just like my former colleague had earlier said. Then the virtuous cycle of data use, where we identify performance challenges and we work together to implement change ideas, monitor for improvement, and experience success and share past peers. So I will soon call on my colleagues, but just to let you know that investment in human capacity for data use results in additional benefits for information system strengthening has been one of our core goals. In the picture here, you can see where the the situation room. This was the situation room where we went to have a training in Akwa Ibom State. I can see one of our colleagues there, the deputy country director of DataFi with the Akwa Ibom team, and we're having just an in-house and training on data use methodology and data analysis and visualizations. And we've continued to do this, and we'll continue to do this as time goes by. And so, not to take too long with the whole process of data use situation room methodology, there are key panelists from Akwa Ibom and Taraba State who have been implementing this situation room. In 2019, like I said, Akwa Ibom started the first HIV situation room in Nigeria, and closely, with support from USAID again, we were asked to go and support Taraba State. And Taraba State also started the situation room 2 years later. And we've seen a lot of progress and great achievement made from the situation room. So please, it is my honor to first of all call on Mr. Odwak, who is the SASCAP MIA officer for Akwa Ibom SASCAP, to come to the podium. Closely followed, I'll call on Hajara Ibrahim Usman, who is the MIA officer for the Taraba Agency for the Control of AIDS, TACA. And please, I also love to call on my colleague from DataFi, Ishak Gidado, to come. I think Ishak will come up faster if you keep on clapping. Thank you. I told you, and he's just at the podium already. Thank you. All right, so please kindly permit me to sit down with you. Okay. And thank you, Mr. Odwak and Hajara and Ishak, for agreeing to be part of this panel. I know that as government stakeholders, you've worked in implementing robust situation room technology and approach in your respective states. And I think this provides a platform for us to get to learn from you, so you could share your experiences, so that those of us who want to implement similar approaches, we can reach out to you or learn one or two on how we can do that. So I'll be asking the first question, which borders on your experience. I didn't want to go through the process of asking you the methodology, because it's basically the same approach that the two states apply, not just the two states, but in the entirety of DataFi. So the first question goes to Mr. Odwak. When you're done answering, I think we'd love to hear from Hajara too. From your experience, how have you used the situation room methodology approach to improve HIV program management in your state? Are there any examples or achievements that you would like to share with us? So let Mr. Odwak go first. Thank you.
Okay, good afternoon, everyone.
Good afternoon, sir.
It's a pleasure to be here. Yeah, the situation room in Akwa Ibom State, we really cannot overemphasize the impact it has had on our services, HIV services in the state, because when it came on board in 2019, and we started the situation room, initially at that point, we were having about 38,000 people on treatment. And then even if you want to look at the number of people, when we talk about linkage was at 62%. And one thing that was happening over and over again was that we were losing people. And so even when we want to talk of suppression was also about 76% or so. But that has greatly changed. And we cannot leave out the impact of the situation room. When the situation room came on board and we started having our weekly meetings, those meetings still continue till today. In fact, this morning I had to leave the hall to join the meeting virtually because the meeting was on today. We have a good team that like we said earlier on, it doesn't have to be me that is there. It doesn't even have to be the Data FI team that is there. Our team, the SI team in the HIV unit, they are all composed and ready to handle situation room at any time. So going back to the question, the impact of the situation room helped us to be looking into where those loopholes were. It helped us to begin to look into close those gaps during those meetings. And when we discussed what could be the causes of why we were not doing that well in terms of providing services, it was from the situation room that preferred all of that. And before the end of about a year or two, we had, in fact, by the end of 2020, we had about 242,000 people on treatment. That is from the earlier 38,000. Now, when we now come to look at the number that have been linked to care had improved, or linkage to care treatment had improved from the 76,000 we started with, and now, or 76% rather, and had now risen to almost 96%. And then it rose again to 98%. So as it is now, practically everything has changed, even suppression. Suppression, those that have, suppression was quite low and has increased to about 98% as we are talking. And so all that came out not just because we were talking, but because people took responsibility. We took responsibility for what they were not doing right, and we continued talking to ourselves in closing those gaps. We had to do this fishbone analysis, and we looked into where those problems were. So the situation room really helped because we brought all our stakeholders, all the partners who were actually carrying out services, HIV services. We brought all of them on board, and they were all ready to learn and also do what they needed to do. And that has really changed the situation in terms of HIV service and treatment in Akwa Ibom. So the situation room has actually been a major tiebreaker for us. It turned everything around in Akwa Ibom State. Thank you.
Thank you so much, sir. If I'll pick on one thing you said, I'll pick on the last statement that the situation room has really been a tiebreaker for Akwa Ibom State. Thank you, sir. Madam Hajara, over to you.
Okay. Thank you, Mr. Nelson. Good afternoon, everyone, and thank you for the opportunity. Though you say you don't want us to talk about the methodology approach, but I would love to say a little about it.
Okay,
it may be different from what Akwa Ibom are doing.
Yes, please go ahead.
Okay, so in Taraba State, what we normally do is a collaborative approach to this thing, problem solving, where we meet with all both state stakeholders and the partners who work in HIV response. In the state stakeholders, we meet, we have representatives from all the line ministries, because we don't only focus on the health sector, we also focus on the non-health sector aspect. So all the line ministries, they have their representative. We have all the partners implementing. We also, it is being led by the state stakeholders through the State Ministry of Health through SASCAP. The SAPC is the chair, while the co-chair is from TACA. So, and we source our data from, we have a data source from different platforms, which include the APPR, the NDR, the CAT, and ENDAS. So we source our data from different platforms. We analyze, identify our gaps. We discuss our new strategies. Then we implement. Then from there we see our results. So for what I want to share, the question that you asked, you say, are there any achievement that I would like to share? Yes, we have achieved so many things in the situation room. So before the situation room, we don't have a strong collaboration between the stakeholders and the partners. But with situation room, where we all meet, both the partners and the stakeholders. So we, from that June 2022, when we commenced the situation room, we have 5 different data use courses. So where we use it to improve our quality of care. And one of these, some of these data use cases that was used is, the first one we use is the continuity of treatment, where we improve our COT from, I think, 87% to 100%. We also use our data to improve our care, to improve the viral loss suppression rate among the children less than 15 years. And we also use index testing too, data case to improve our index testing, and also offer an acceptance rate. Also the PMTST. Well, there was a time that we were reviewing our data, so we saw that we have low coverage in our ART coverage among PLHC pregnant women. So it was that data that was used, and corrective measures were implemented, and we were able to improve our ART among the pregnant women. So situation room is one of the best things that happen in our HIV program in Taraba State.
Thank you so much. Yeah. And I'm sure our funder will be happy to hear that situation room is one of the best things that has happened to them, because they have actually provided this funding for this to actually take place. So thank you to our funder too for making this possible. And so, not to put you on the spot, Ajia, I think I would like you to answer the next question first before Mr. Udwa can provide responses. So since we want to learn from you and understand how you've been deploying these approaches, what are some instances where substantial data use has affected policy and planning in your state? Are there key areas where you can mention?
Okay. For planning, what I can say is, I can't say there's actually one policy that was using our data use case, but through the situation room, we were able to set up a monthly, regular coordinating meeting that is led by SASCAP, where all the the SASCAP lead the meeting, where all the IPs that are working under pediatric meet together, review the data for pediatric and young adults. So that data use case that was used to improve the viral loss suppression among the pediatric, it was through this coordination meeting that was set up at the situation room. So we used that coordination to review data, and we saw that gap. So we came up with some strategies, and the strategies were implemented. So that's one of the this achievement that we were able to set through the situation room. Then another thing is right now, currently sitting on our action point tracker, where action point was generated during the situation room. We're trying to see how we can set up or strengthen quality improvement across all our comprehensive sites in the state, to have, for the facilities that have this QI structure, we want to see how we can strengthen it. For those that doesn't have, we want to see how we can set up that structure across all the facilities. So it's one of the things that we're able to come up with it in the situation room.
Okay, thank you so much. Yeah. Mr. Odwak, over to you, sir.
Still talking about policy and planning. The Situation Room in Akwa Ibom State has actually been the main unifying point for coordination. Yes, we do have other coordination meetings, TWGs, other meetings, PMTCT meetings here and there, but it starts and it has really improved from the Situation Room meetings. And it has also helped to bring a better coordinated response from every partner. Okay. All of us, as we come together and we talk frankly, we talk in depth. It's not about finding faults, but we talk and we agree on issues that are not moving right and then get it right. We start talking from there. So the Situation Room has really helped us, has been a very, I used the word tiebreaker before, but it has been a major strategy to help in building policy and planning. And I want to give one particular instance. There was a time we were having very poor coverage of our pediatrics, 0 to 14, when we were having coverages as low as 62%. And then it was through the use of the Situation Room, we began to look into where were the issues coming from? Why were we having this poor coverage, poor suppression of our pediatrics? And it was through our collaboration and talking in the Situation Room meetings that we were able to bring out what the issues were, and then we worked on those issues and planned and actually utilized bringing out results. By the end of a year later, we were on 91% in terms of coverage and 96% in terms of suppression for pediatrics. And it has improved ever since. It has remained at that level since. Now that is just because we've all come together as partners, and we've all understood that nobody's out to witch hunt the other person. It's about, let's get it right. And so the Situation Room has helped us to not really change policy, but work on attitude, get it right, and then where those gaps are, we correct and close it. So the Situation Room has been a major strategy changer for us.
Okay, thank you so much for your response. And to Ishak, let me kindly ask, what have you learned about the Situation Room methodology that you would like to share with us? As a stakeholder who has implemented Situation Room and supported the states in carrying out this methodology, what have you learned? What share with us?
Thank you, Nelson, and good evening, everyone. So one key thing I learned about Situation Room and what makes it successful is collaboration. And collaboration in the Situation Room has to start right from the beginning. So what we did in Taraba was that when we wanted to support the Taraba State AIDS Control Agency to set up the Situation Room, we ensured that we involve everybody, including all the line ministries, as she mentioned, that work in the non-health sector, and then, of course, the Ministry of Health, that is through SASCAP, that work in the health sector. So we also ensure that we include all the implementing partners, both the implementing partners that are funded by USAID and other partners that have other source of funding. And this collaboration extends not only by doing invitation for the Situation Room meetings, but we also included them in the capacity building for the Situation Room. So we trained IP staff as well as government staff before the commencement of Situation Room meetings in Taraba. Secondly, what makes Situation Room successful based on our experience in Taraba is consistency in the method of analysis and visualization. So, for instance, if we are looking at HIV testing services, in week 1, the visualization and analysis method that we are using shouldn't be different when we are looking at it in week 2 and week 3, so that people will be consistent in seeing what you want them to see. So consistency plays a very key role. The third one that I would like to also share is documentation. You have to make sure that you are documenting everything. So what we do is that we have a Microsoft Excel tracker that we document every action point from each situation room meetings. Beyond just documenting the action point, we categorize the action points by thematic area. And then we document the date it was initiated, and then we track it on weekly basis. And also we have a summary sheet where our action points are being summarized, so that after a month or on a quarterly basis, we can take a review. We can take a step back and look at what we are doing. How many action points have we worked on in this particular quarter? How many were we able to implement? So without documentation, you cannot have such valuable information. So I will share 3 of these: is consistency in the analysis and visualization, collaboration, making sure that you involve everyone, of course, then the documentation aspect of it. Thank you.
All right, and thank you so much for that insight into your experiences, Ishak. And so I'll go back to asking the government of Nigeria these questions again. What challenges have you encountered in implementing data use strategy in the state, and what can be done to tackle these challenges? And that is, I'm talking about the barriers to data use. There is no system without its own flaws and challenges. No system is perfect. So along the line, I'm sure you must have had challenges. Let's not just look at the fine picture outside. What's the processes that are made up that there could have been some stress and challenges and obstacles along the way? So please, can you share some of those challenges with us? So Mr. Odwak, starting with you.
Okay, in terms of challenges, I'm looking at it just beyond just HIV in itself. A major challenge for us has been, because we started the situation room and used HIV as the entry point, but we didn't want it to end with HIV. We wanted it to be like a health situation room where all other thematic areas, when I'm talking of other areas, immunization, TB, malaria, bringing all other health areas into the situation room, whereby anybody that comes to enter situation room meeting can have a glance at that period to know what is actually happening in the state. We've not been very successful. It is an ongoing process, but I must say it has been a little slow, and that's been a challenge for us. Although, TB has come on board very well, so we do have a good collaboration with TB. Once upon a time, we have been talking with malaria, but the malaria program, there have been 1 or 2 issues here and there. So for us, in my own opinion, the major challenge has been strengthening that collaboration with all other areas of health to use the situation room the way we are choose for that week. Because you're either your APIs for us, not being able to get the data we need at the time we actually need it. Because it's supposed to be real-time data action. We're supposed to work on our data as it comes. So we have issues with that. Sometimes we used to have issue also with even light, because all these things we use in the office. Remember, we're part of Nigeria. Even though we had all what we needed at a point, but even our solar system, sometimes it comes down. And when you want to start a meeting and everybody is seated, and then you cannot have a meeting. So these have been like challenges that come up here and there, and we know that we're in Nigeria, we'll get it right at some point, but for now, we tackle those challenges as they come.
Thank you so much for your response and to that, and I'm sure we may be able to find a preferred solution when we get to the next question about what the government intends to do to improve the system. Thank you. Haji, over to you.
Okay. So, what I want to say, we have challenges, but I think in Taraba State, our major challenge for now is getting buy-in by our partners, both our partners and our service providers at the facility level. Because the reason why I say from partners, because they are the one that are providing technical support at the facility level. So whatever amount of resources you allocate, if we review the data, we identify gap that needs urgent attention. But if that getting buy-in is not there, whatever resources you allocate to that, it will not. You will not see any changes because they will not see it as an important something when it is something that needs urgent attention. So the major challenge I can say for now is getting buy-in by both the partners and the service providers at the facility level. Thank you.
Thank you so much for that, Hajara. I just have one more question for you, but before I ask that question, to our participants and guests, please, as you're listening in, you can kindly use the barcode on the paper that you have in front of you. There's a section for data use. You can just scan that barcode to input your question so that when we're done, we can read out your questions, and then the panelists can provide answers to your questions. All right. So we know that government cannot fix everything, and that is why we're also here as individuals to see how best we can go. Yeah. And so as a government now, and I'm bringing this question to you, you've also raised challenges, and challenges will always be part of the system. As a matter of fact, they will not stop. They will continue to come up every day. And what makes you creative is being able to go around these challenges and find a way around it, which is the beauty of life. So as a government, I'm asking, what plans does the government have for sustainability? And what are some investment or plans that the government has and is currently doing? Maybe something now or something in the future. Because even the donor and the partners will not be here forever. At some point in time, the government will need to own up. And I'm happy that we've actually owned up to, in some processes, in just hearing you speak, I can see that sense of responsibility from the government in being able to harness resources and bring people together to take that leadership role, to coordinate things. But beyond just the aspect of coordination, what plans for sustainability does the government have? So Hajira, let me start with you, please.
Okay. So for sustainability plan, let me start with human resource. Though one of our problem here is the human resource. We have inadequate human resources that have the capacity, let me say, to analyze data for decision making. So this is one of our issue, but we have technical support from the data file, where we are all working together with the SACA and the SASCAP SI staffs. We work together with DataFi. DataFi is supporting us with some technical support. So, but we need more, if possible, if we can have more training to build the capacity of the GOIN staff to be able to analyze data for decision making after DataFi for sustainability. And what the government have in place, I think for Taraba State, the facility where the situation room is domiciled is in the government building, which is the TACA complex, the conference hall for the TACA. That's where we hold our weekly meeting. So I think it's one of the plan for the sustainability. It's well furnished and it's furnished by the government. So I think for this one, I think I can say it's, we have a good sustainability plan in terms of
Thank you so much, and Hajara. Yeah, Mr. Odwak.
Okay, so for Akwa Ibom, the sustainability plan started from the very word go. When we, like Hajia has just said, when we even thought about the concept of the situation room, the idea was, where are we going to start it? Will it be inside? Will it be outside? And thankfully, government said, let it be inside the office, so that we know that it is there with us. And yes, the partners and USID, we want to thank them that they supported us with giving us batteries and all of that, giving us the panels that we use. But for the fact that we have it in the office, it was to sustain it so that it remains with us. The government still provides light when it can. But when we don't have light, that's when we now fall back to the power supply that we have from our batteries and solar, which has been provided. So, but again, I still also want to say that sustainability is a continuous thing. We are always talking with government. We're talking with our leaders. We continuously bring in advocacy to tell them, to let them understand that this project, this has come to stay and is our own. And even when at a point in time, our situation room, it looked as if things were not going to work well, it was even the commissioner and the permanent secretary that came to the office to come and, because we had told them things were going bad. And they were the ones that came, saw what was on ground, and then they planned with us and left. Yes, they didn't provide the final thing. It still came back to partners. But it's a continuous process. Again, we've talked about the human resource. The trainings we do is a continuous one. And we've continued to train our people in the HIV units. And we even went beyond when DataFi came to do a training with us on analytics at a point in time, we made sure that we called all the other thematic, we call people from malaria, call people from immunization, call people from growth monitoring, call people from TB, from everywhere to be part of it, because we want them to be all part of what is going on, that it will be a consistent process. And even though these trainings were going on, they still understand that that is part of our plan to sustain what has been started. And we believe that we'll continue that process. So the three things we're doing, one is advocacy. We're still consistently talking to our policymakers to help us to know that the situation room, so that they buy in, they own the situation room. Two, the physical facilities itself, it's within the confines of government, so government owns it, where they know it's their own. And thirdly, we are consistently training.
Thank you so much, Mr. Odwak, for that response. Ishak, you're also on this panel, so let's hear from you as a partner who is implementing. What do you think you can do as an IP to help states achieve or attain sustainability, even many years after you might have gone? Thank you.
All right. So thank you, Nelson. So I think as partners, we started talking and considering sustainability right at the beginning of our support to the state. So in citing the location of the situation room, we first recommended that we want it to be owned by the government and, if possible, to be hosted in a government premises. And to a large extent, we have achieved that in all our situation rooms, including Akwa Ibom, Taraba, and other COVID-19 states. The idea behind it is that government should have that ownership, even at the beginning, that we are there to provide technical support. And that is what exactly we are doing currently. We are providing technical support, and we are, to achieve that, we are mentoring the SI staff of the government agencies and the ministries that are involved. We are building their capacity in the situation room methodologies and some level of data analysis. It's a gradual process. We've been doing it. And as I am telling you, this week, all of us that are supporting, that are providing support to the states, to about 10 states, 9 or 10 states, we are here in this room. But our situation room meetings in those states did not stop because there are government staff that we have mentored, we've built their capacity to some extent, and they are able to facilitate those processes. So what we do is we provide technical support, but we don't take that ownership position. The meetings are chaired by government, DataFi, we don't put ourselves in those positions. So these are deliberately being formulated for sustainability. So I think what we will continue to do is to continue to strengthen this capacity building, and then also engage the government in an advocacy to provide, to come up with a modality that this is how best we think you can continue with the situation rooms at the close up of our project. Thank you.
Okay, and thank you so much. And thanks to our panelists for taking time to be on this panel session and to provide responses to questions that have been asked, and also share your experiences. And I'm sure that there are those in the audience who have 1 or 2 questions for us. So Abba, I don't know if we have questions that have been documented so that the panelists can provide answers to them. Okay, so maybe let's take 1 or 2 questions. Okay, I can see some hands up. Okay.
Well, good afternoon, everyone. I'm Dr. Garba Danjuma, Director General, Taraba State Air Control Agency. Mine is not a question, but it's more of a kind of comments and then also appreciation. Let me first of all start by thanking USAID for supporting Taraba State to establish a situation room, which is hosted in the Taraba State Control Agency. And equally, our brothers and sisters from Akwa Ibom, thank you. I think we first went to Akwa Ibom for study tour before we established our situation room in Jalingo, which was led by Dr. Dauda and his team. Well, for us in Taraba, I think this is a revolution in terms of data management, the coming of DataFi, because that's a gift for data for evidence-based advocacy. I remember several times, within a minute, I would call Isiago or Hajara to give me data on the situation of Taraba, when I maybe 1 or 2 government officials, and they will send it within a minute. The coverage, the various operations, so it has helped us in doing evidence-based advocacy, and also for planning for the health sector. In terms of sustainability, I think one thing I can say is, as they said, is within the office of the government, and also have a budget line for research, including management of the data room in Taka. And that has been approved by the government of Taraba State. And also what we are trying to do is to ensure that we have HIV under our roof in Taraba State. Within the Taka complex, we have the Japago rice. They are within that complex, DataFi, SFH, NEP1, among others. So everybody within the Taka building. And that, for us to leverage our resources, and everybody meets weekly to discuss HIV, and then if there is any space within the ecosystem, we'll see how we can manage it together. And I want to also say, with the coming of the DataFi, we're able to establish the CITES committee for the first time in Taraba State. I want to comment Dr. Dauda and his team. When he came, we discussed that, and I was able to push with the support of DataFi For the first time, we have a research ethics committee in Taraba State Ministry of Health. Let's clap for DataFi. And coincidentally, having to be the chairman of that HREC. So beside the issue of the budget line, our next step is, beside the data use cases, we want to be making some publications. Because I felt there is a lot of data, I'm sure about in Akwa Ibom and Taraba, that have not actually showcased it beside the data use cases we are doing. We need to begin publications in high impact journals, peer review journals. I think these are the next steps we are considering as a state. Similarly, in terms of sustainability, now what we are doing in Taraba, we are piloting 3 LGS as a model for sustainability. And the plan is we are using only government staff, not ad hoc staff by RISE. The government pays the staff. I've been trained already. So we want to use as a model. After the exit of RISE, funded by USAID, what happens? So 3 LGS now are almost fully supported by Taraba State government to see how can we go, because we are thinking maybe by next year the IPs will leave. So that platform for the social room provides several opportunities. This is a point of entry for most of the IPs coming to Taraba. We discuss not only HIV-related issues, but other issues that are not even HIV-related. For instance, last month or 2 months ago, Northeast Development Commission came to Taraba, they want to do a project. So the meeting point, everybody knows on Wednesdays, they are going to meet virtually all the stakeholders there and provide a platform to disseminate information and also to leverage on resources. So I want to say the coming of DataFi through the Palladium implemented by funding USAID is a breakthrough in the HIV response and other HIV-related diseases in Taraba State. Thank you for giving me the opportunity to talk.
Thank you, sir. Thank you. Do we have any other question before we wrap up this session, please? Okay.
Good afternoon, distinguished ladies and gentlemen. I am MM Xavier from Akwa Ibom State, the PMTCT coordinator. I want to first of all appreciate DataFi for coming as a solution to our service delivery as far as the HIV space is concerned. We are so happy that so many countries and states have come to, learn from Akwa Ibom State Situation Room. And we know that no matter what success you have recorded, you will still have some challenges that are just beneath. And you would want to also upgrade. So I thank you for what you have done. You've given us the technical support. And as our panelist, Mr. Udwaka, M&E officer, has said, even this morning, our situation room was running very well. Even though the state lead is not there, the SAPC director is not there, I am not there. But people, GON staff, were able to, run the meeting very well. But we have an issue since this is a peer learning environment or meeting, I would say. We are not ashamed to say that we still need your TA in a certain area. Like M&E has said, concept of the situation room was not just for HIV service delivery, but it was to also integrate other disease areas. But it's like, despite the fact that we have actually made some gains, made some impact, we need to see how other disease areas have come on board so that we will be, we'll feel fulfilled that this is actually happening as far as the health and the non-health sector is concerned. I have learned that the line ministries are also part of Taraba State. Taraba State came to learn from us. And so we should, by right, be ahead. And so we need you to TA us on how to get the other service areas integrated, that is, seemingly get it done. Although we are not resting on our horses, TB has come on board today. TB was the one actually, displaying what is happening in the TB space. So we will still require some TA to ensuring that other disease areas come on board. Aside that, we want to really appreciate you, because for PMTCT there was a time that I was actually sounding like a broken record in every meeting, and it's like that critical area, the pregnant women and the pediatrics were left behind during the surge and all that. And there is no way you can reach epidemic control without taking charge of those other two critical populations. But I thank God that through the situation room and through the implementations, we've been able to identify gaps, and USAID has also come up with the scale up, and Nigerian government has come up with the PMTC scale up and all that. So there is really improvement, and I am sure if we continue to build on our gains, we will be able to ensure the epidemic control that we are heading towards by 2030. At least we are hopeful. Thank you so much, DataFi. You have impacted us. Our capacities have been built, and a lot of other things, the webinars we are able to present, we are able to, do data analysis, analytics, and all that, and then we're able to identify our gaps, and then sit down to discuss at partners and government to see how we can fill the gaps. And I tell you, we have greatly improved. Thank you so much. We are grateful.
Thank you so much, Madam MM. Your challenges have been well noted. The good thing about challenges is that every challenge comes with its own opportunities. So I think maybe this presents another form of opportunities for us to further collaborate more. And I can assure you that the DataFi leadership, I don't know, they are here to also act on that. And I'm glad that they'll just listen whenever the state government speaks. So they will also listen this time around and act on it. Thank you so much. If there are no more questions, okay.
Yeah, so we have some questions online, so I'll just read them out, especially the ones that have not been answered before. So the first one is, what is the government doing to ensure sustainability of the situation room?
Okay. Who wants to go first? Can you come back with the question again?
Okay, I hear it has been answered, so let me just move on to the next one.
Okay.
Yeah? So this one says, what is the difference between the situation room meetings, which are disease-specific, and the EOC meetings? And is there any aspect of the situation room meetings that EOC meetings can leverage on to improve their effectiveness?
Okay, so do you want to speak on this before I speak?
Maybe I can say one or two things. Okay. The EOC meetings, to the best of my knowledge in Akwa Ibom, are centered around COVID. And we have an EOC center. So they have their meetings at their own center, situation room. While the situation room where we have our meetings is centered around disease control of HIV for now. But like I said, we are bringing on board other disease areas. But this is except COVID. I don't know if that answers that question as the difference between EOC and meetings and situation room meetings.
Okay, yeah, so there's a second part.
The second part, what was the second part again?
So they're asking, are there any lessons or from experience from the situation room do you think that the EOC could leverage on to improve their effectiveness also, so that the EOC can be as effective at the situation room?
Yeah, what we are doing well is there's a very efficient collaboration between stakeholders and government. That is, when I'm talking of stakeholders, I'm talking about the partners now. We have a very smooth, very good working relationship, and that has actually helped us to get the situation room moving in terms of putting the right attitude and all of that. And if that is replicated in the EOC, there will definitely be a better response towards handling the COVID situation. Outside that, I think let me stop there.
Okay, and thank you, Mr. Odwak. So let me just add a few things here. The HIV situation room was actually the entry point through which USAID brought situation room to Akwa Ibom State, and that happened to be the first in Nigeria in 2019. However, when COVID came up, USAID proposed to support 8 states, 4 in the south and 4 up north. So what happened was that then we were only operating one situation room in Akwa Ibom State, which was HIV, though an entry point. And where now the discussion is centered around how we can integrate services and all of that. So when COVID came, COVID was operating in some states where you never had a HIV situation room. So it was like the COVID Emergency Operations Center also became an entry point through which situation rooms got into those places. But however, we've taken a step further with the last minister's approach and even this current minister of having an integrated health digitalization. We've currently, Edo State, yesterday the Consular General commissioned the integrated health emergency operations center in Edo State, where we now have HIV situation room and COVID situation room all in one space. So there's nothing like having different situation rooms for HIV and different for COVID. So, and that is where we are looking at now to see how we can take things further. And based on the request that Madam MM talked about, and also the challenge that Mr. Odwak said here, these are some of the things that we are looking at to see how we can now begin to bring in every disease area, whether COVID or malaria or tuberculosis, into one space. I think for me, these are some ways in which resources can be best utilized and managed instead of having different setups in one place when they can actually be brought under one roof. It helps for better coordination. So I think these are areas where we can also learn from. Edo State has already done that and it is working. And I'm sure other states can also take that stuff too. Thank you.
Okay, so the last question is, what capacity building initiatives are in place to enhance data use skills among HIV program staff?
Okay, so as an organization, we have been building the capacity of the state government, where USAID supports. And these capacity buildings are not just on a yearly basis, but some of them are quarterly or biannual. We build the capacity of government in data analytics, in visualizations, in being able to write abstracts, and we're always able and willing to support governments to develop these abstracts and come up with their own ideas and showcases to the global audience. We provided platforms for states to also share experience and learn from one another. And there are plans to also further build our capacity, not just in visualizations, but also in them also being able to be responsible for some of these digitalization tools that we're talking about at the LAMIS Plus and the rest of them. So there are a lot of opportunities out there where the capacity of states have been built, and we've not stopped there. It's a continuous process. Even before the end of this FY, more capacity building sessions will be done. Recently, DataFire as a project had a capacity building session in Edo State. We had one in Taraba last year. We had another in Akwa Ibom. And even before the year end, some of these capacity building sessions are still going to continue happening in all of the states. Thank you. Okay, so I think we've been signaled that there are no more questions. So I want to thank all my panelists for taking time to be with us on this panel this evening. Thank you so much.
Please give our panelists another warm round of applause. Thank you so much. Thank you to that expert team of specialists who gave us a roundup of data use methodology case presentations from Akwa Ibom and Taraba Situation Room implementations. That was a very wonderful conversation. And that brings us to the end of the first day of Digital and Data Use Forum 2024. I mean, it's been a wonderful day so far, right? Was it a good day? Was it engaging? Was it worth our time? Are we going to be here tomorrow? I'm not getting a confident feedback. Are we going to be here tomorrow? I want it louder. Are we going to be here tomorrow? Okay, so I'm just going to give you a sneak peek into some of the conversations that we would expect tomorrow. So tomorrow we'll be having conversations around Integrated Health Emergency Operations Center. If you want to know more around that, how effective the coordination mechanism has been for emergency response in Nigeria, then you should be here. You shouldn't be somewhere else. We have case presentations for PHEOCs across the states. If you want to hear some of those cases, you should be here. If you want to hear about digital applications supporting community-driven interventions, you know where to be, right here. If you also want to learn more about exploring challenges and solutions in implementing community-centered digital interventions, you should be here. We are basically going to have some big wings in the room tomorrow. We'll have representatives from Federal Ministry of Health, from the World Bank, and some other big figures and great partners of ours. So please make it a date. We expect to see you here tomorrow. We expect to continue the conversation, and we are very grateful to have had you here for the full day. We don't take it for granted. I know it's been a busy time for everyone, but you dedicated your time to be here and to be part of this conversation. So please indulge me when I say that this round of applause goes to each and every one of you. Please clap for yourselves and clap for you. Clap like you mean it for you, please. Thank you very much. Okay, so just to recognize a few couple of persons. We have from Adamawa, Mr. Titus Tennyson, the PM CERIC, that is the State Emergency Routine Immunization Coordination Center. A round of applause for him, please. He's over there. And from Bauchi, we have Mr. Owa Husseini from the State Amid Focal Person, Primary Healthcare Development Agency, Bauchi State. You're welcome, sir. It's very wonderful to have you in the room. And from Oyo State, we have Dr. Iyabo Karim, the state epidemiologist from Oyo State Ministry of Health. Thank you so much, Ma. Thank you for your time. Thank you for being here. We appreciate your being part of us. So just as a closure to the day, we are going to be having a very small but warm networking event. Immediately after this, there'll be tea outside. Feel free. We've been talking a lot on a lot of technical issues. Now is the time to really get to know who is sitting beside you or who is sitting on the table next to you. So feel free to connect with people, talk, network, engage, exchange cards, exchange ideas, or exchange any other thing that you would want to. It's fine. We'll do that over tea. It's the end of the session today from myself and from my co-host. Thank you very much for being such good sports. And we look forward to seeing you tomorrow. Have a wonderful night.
Thank you so much, everyone.